how to actually double or even triple your monthly referrals, even with the current COVID-19 restrictions. Now, before we get started, I just want to be able to ask you guys, how are you guys doing right now? How's everything going on with you guys? Are you guys staying safe out there? That's the main goal right now, is to be able to, stay safe as possible. But because we're in this certain industry, this a very essential industry such as the home health or the home care industry, we have to be out there. We have to be taking care of our patients. Whether you're a caregiver, you're a nurse, you're an administrator, owner of a company, we have to take care of our patients, even with all these restrictions, with all the fears that's going on right now. So first of all, for all you guys out there, you caretakers, you nurses, you therapists, you owners out there of home health and home care companies, I just want to say, thank you so much for providing great care for your patients, your clients, your referral sources, right? But what I want to be able to do is have this quick webinar. It's not going to be really quick. It's going to be a little bit long, maybe about 2 hours long or so. And, bear with me. I want to be able to provide you guys with as much valuable information as possible. We actually put this thing together because we work with a lot of agencies out there, and we're getting a lot of phone calls, a lot of emails, a lot of, DM, direct messages, through our YouTube channel, through our Facebook page, through our web page, right? And people are just asking us, hey, Michael, what can we do? And we want to be able to share with you guys, what currently we're doing right now, so that we can help you with your company to seriously double, triple your referrals, even right now at this, current state that we're actually in. Our goal for you in this webinar is show you guys like how, some agencies are still increasing their census and gaining more referrals, while other agencies are having problems and facing financial difficulties due to the COVID-19 epidemic that's going on right now. So are you currently facing problems with your marketing, or no agencies that are? Have you seen, a decrease, for example, in your referrals to your agencies? Are you having, patients, all of a sudden choosing to stop services due to, the fear of getting, this virus? Our current patients canceling their services, or new referrals saying that, we choose not to get any service at this moment, or family members of your patients are just saying that, what, we don't want anybody coming into our mom's house. We just don't want a lot of foot traffic. Or do you guys have marketers, or are you a marketer working for your agency that, is not meeting your quotas at this very moment? Or even, do you guys have employees that, unfortunately, because you're not having a lot of referrals, that you have to furlough your employees? Like, you have to get rid of some people. Maybe your office, you're trying to keep it a limited staff in your office, and so you have to get rid of some people. A lot of these things, the current agencies we work with are facing. And we also hear a lot of other agencies that we're not consulting with are asking us questions and asking us for help to see what we can kind of come up for them. And we want to be able to share with you guys, what can you do at this very moment that's going to be beneficial for you guys. So this portion right now of the video, this video that you're watching, is part of a 3-part video series. And our goal is to give you value and help provide answers and solutions to a lot of the questions that you guys are having. So whether you're watching this video live right now at this very moment, welcome to you guys. Or if you're watching this video in a replay session, I just want to say thank you so much, and we want to be able to share with you guys. Now, before I even go further, some of you guys know who I am already, know that our company, who we are. And some of you guys are watching this video for the first time, or seeing me for the first time, and you're like, who is this guy, right? So first of all, my name is Michael Echeverria, and I'm with a company called Home Health Success Academy and 10xpatientreferrals.com. And our team, right, our team of amazing people, have been helping agencies increase referrals and become profitable, right? And, just for full disclosure, you guys, so you guys know a little bit background about myself, is that I own and operate several other home health agencies and home care companies located all throughout the United States. To be exact, 4 home health agencies and 3 home care companies, the non-medical type of home care companies. And what I'm going to be doing in this video is, share with you guys some secret strategies and tactics that has been helping the agencies that I own and the agencies that we consult for beat the competition, especially at this moment in time that we're facing right now, right? So in the part 1 of the webinar, which is where we are right now, we are sharing the 5 main problems that are being faced by the agencies at this very moment. During the COVID-19 epidemic, from our surveys, as well as what companies we consult with have shared with us. And then what we're going to do is that we're going to show you the simple solutions that if you guys actually implement at this very moment, you're going to be able to gain more referrals. Then we're going to move on to part two. And in the part two of this series, we will share with you how to get an unfair advantage from the COVID-19 epidemic. How to be able to take this current, step back of people, and how to actually use that to your advantage and to actually start gaining more referrals. That's the amazing part of things, right? So, when we move on to part three, we will then show you, how to actually prepare and really surpass your competitions once the restriction is lifted, right? Because eventually we're going to hit the peak of this epidemic, and then we're going to start seeing a decrease, and we're going to start seeing things opening up. And what we want to be able to do, share with you guys, is that once the restrictions to the public opens up, how to be able to pretty much springboard your company to be able to beat the competition. Now, throughout part three of the video series, we will also share with you how to find the problems that people are facing and how to solve them, and then to become that preferred provider, to provide services, to get those referrals for patients and for your clients. That is ultimately the main goal here, is to be able to be successful in this, right? So let's talk about the top 5 main problems that has been shared with us, that we've seen, and even some stuff that we've experienced in the beginning of this whole phase, and we anticipated it. And we did this through a lot of mastermind meeting, a lot of talks, and a lot of, looking at, current trends that's going on. So the top 5 main problems that agencies like yourself, home health or home care agencies, or even hospice agencies are facing is, the first one, really the big problem, the big number one, is not being allowed to visit facilities. Number 2 is that referrals are starting to dwindle, are starting to go down, right? We're not getting a lot of referrals. And then number 3, current patients, unfortunately, are canceling services. Number 4, unable to gain new referral sources. And number 5 is agencies are having cash flow problems, right? And so that ultimately is probably one of the big things as well. Number 1 and number 5 is probably the most biggest things that we're going to be facing in this problem that's happening at this very moment. And I want you guys to be able to look into that. Now, just to let you guys know, since this is a live video and we're videotaping it, I will take pauses. I will go take a sip of my coffee right now that I have with me. So, if I do that, I just want to, first of all, apologize already right there and then. I'm at home right now at this very moment as well. I'm at home. I'm in my home studio. We're making this video right now for you guys so that we can share it with you guys, right? And so let's go ahead and start talking about those top 5 problems that's being faced and how we can actually find solutions for them, right? So let me ask you, what problems, out of the 5 that I shared with you guys, right? What problems have you been facing at this very moment? Are all 5 of them up? Do they all apply to your business right now? Or maybe 3 out of 5? Or maybe just even 1? And so, which one is it right now? And if you guys don't mind, we want to be able to hear from you guys. So whether you email us at this very moment, send us a text message, whatever you want to do, let us know which one of those problems that you guys are facing, right? Are you seeing a decrease in the referrals or staggered growth in your census due to the COVID scare that's going on, right? And we want to be able to know that. Now, towards the end of the video, I'm also going to be able to give you some amazing free bonuses that will even supercharge your marketing. So make sure that you pay attention to take advantage, of the limited offers that we want to be able to share with you, right? Throughout the presentation as well, please pay attention because we will share a lot of golden nuggets of information. So, just a quick housekeeping thing going on in this webinar. We want to be able to get your full attention. So if your phone is right next to you because everybody's addicted to their phone, go ahead and, just turn off the phone. That's one thing. Number 2, you just, keep it on silent. Number 3, if the vibrator's on, keep it off as well. And the reason for that is because we don't want you guys to get distracted. If you get distracted, what's going to happen is you're going to miss certain things as we go through this whole process. Okay, so please pay attention because we're trying to share with you guys some amazing information that's going to be helpful for you guys. Okay, so first of all, great. I'm glad that you are here. So let's get started talking about the problems you may be facing in marketing during this whole COVID scare. And let's get ahead started with problem number one. And problem number one is unable to visit facilities. Is that happening? Of course it is, right? Because a lot of states are shut down. There are a few states that are still kind of straggling a little bit. They don't want to shut down fully yet. But most states are doing this right now at this very moment, especially healthcare facilities, right? And so we want to be able to discuss that. Is that happening to you guys? Are you hearing your marketers telling you that they're not able to come in because facilities are closed? They're closing down. In turn, when these facilities close down, not allowing people to the outside come in, it lessens potential referrals and even losing referrals to other agencies. Now, just to let you guys know, I definitely know a lot of agencies are losing referral sources because the agencies that I own, the agencies that I operate, and other agencies we're consulting for are seeing a spike in referrals. And managing, this is an important thing, right? So if my agency is gaining a few referral sources through this short epidemic that's going on, and other agencies that we're consulting for are also getting this, that means other agencies are losing referral source because we're getting it, okay? So there's a way to be able to handle that and to be able to plow through with this whole thing. So what if you right now can make sure that you would not lose referral sources? And what if you can actually gain more at this very moment? How much would actually that be worth for you? Like, how much would it be worth if you can get an additional referral source that's referring maybe 5 patients a week, or another referral source that's referring maybe 2 patients a month? How much is that worth for you if you can get that this very moment? And in the long end of things, if they remain with your business, how much is that worth for you guys? If you're a home health agency and you're billing $5,000 in average per patient for that services, if you get 2 more patients a month, that's $10,000. That's a lot, right? So you have to understand is like, how much is it worth for you if you can get more referral sources giving you guys? Like, you're taking that away from other agencies, or you're making sure that you're not losing it to other agencies. So most agencies really only rely on the cold walk-in style marketing, meaning that they walk into a facility and then they try to market their services, okay? Now, in our full boot camp that we have, the online marketing boot camp or our live boot camps, we actually go step-by-step process and spend 8 hours to really expand on how to be able to handle the cold walk-ins. But yeah, most of you guys will walk into a facility and try to get them to start referring to you guys. And so other than cold walk-ins, we try to nurture them by visiting them, right? If we're able to start getting referrals, we just visit them again. The question is, how many times do we visit them a month, okay? But now, with all of a sudden, with this closure of these facilities, okay, with the closure of these facilities, that is where problem starts happening, right? Out of sight, out of mind. And so that can potentially cause problems with us. And most of the time is when we're working with facilities, when they're referring patients to us, it's because we solve a particular problem that you're facing. But with the larger problems that are going on with the COVID-19, there's other problems that they're facing at this very moment that we should probably be solving, right? Now, if you guys probably started looking back and when we started seeing a lot of the problems that were happening with the COVID-19 scare, there was that one nursing home in Washington State. And that was one of the first nursing homes that for some reason had over 70 people positive with the COVID-19 virus. And so they shut down that place, right? They shut it down. And other facilities, other nursing homes were starting to see that. And they said, well, we need to shut our place down. So everyone was like, all right, nobody in, nobody out. So guess what? Family members couldn't visit. Definitely sales and marketers like ourselves cannot visit. All of a sudden, people, not even family and friends, could visit, right? So with that, we have to understand that we can lose this type of business, especially if the only thing that you're good at, the only thing that you have been doing in marketing is actually just walking in and visiting, okay? What we teach in our sales training, in our marketing education, is that you should actually be doing more than just cold walk-ins, right? And also understand that you need to also make sure that you look at the trends that are happening. And before we had that experience in Washington, with that nursing home, that the first nursing home that had over 70 patients with positive COVID, we were already monitoring what was going on in China, monitoring everything what was going on in Asia and Europe. And my team was sitting down and we're saying, you know what, this seems like it's going to get to the US eventually. And so we decided that we wanted to be ready for what was going on. We just wanted to be ready. Most companies don't look at trends. Most companies, even outside the industry, the home health industry or home care industry, don't look at trends. And these are sometimes major companies. A good example for, is, Amazon, right? Amazon came along selling books, right? Then they created the ebook, the Kindle, and they were making lots of money with that. And that because of what they were doing, Barnes and Nobles, Borders bookstores, who should have done it in the first place, and they were romanticizing the way they were doing business previously, is the companies that actually did not look at the trend and shut down. If you guys remember Blockbuster, they used to be around everywhere, right? I remember I used to go to Blockbuster a lot, but they did not follow the trend, and Netflix came along and closed them up. And so we have to be understanding that as a home care company, as a home health agency, we cannot romanticize the old ways of marketing. We must be able to introduce new ways and understand that things are changing as well, okay? So let me share with you guys, what we decided to do. And this is way before the COVID scare. We started doing this already in our follow-up system for our company. And so we want to be able to share this with you guys, as this is a particular thing that you should be doing as well. So part of the whole marketing thing that we do for a lot of our residents, for a lot of referral sources, is that we always do call follow-ups. So when we started seeing things happening, right, when we started seeing that there's going to be some problems that's going to be faced, we started making sure we made phone calls. We said, hey, we just want to be able to reach out and find out, are you guys planning to do a full shutdown? And if they said, yes, perfect, that's great. Just let you know we're here for you guys and we want to be able to help you. Is there anything that we can assist with you guys? Do you have any patients that needs to be followed up? Do you have any family members that needs to be educated about what's going on? And we wanted to be part of that company, part of those nursing homes, those skilled nursing facilities, those assisted living facilities, the hospitals. We reached out right away and called every single one of them, okay? Next thing is we sent emails. Now, we always call all of our referral sources every week. As much as possible, a minimum of one time a week, we always call our referral sources. Is this something that you guys actually do on a continual basis? Don't tell me I called once a month. No, weekly, okay? Especially now that we cannot be face-to-face with them, we need to be able to be more active and making sure that we actually follow up through with phone calls. Next thing also is we started sending emails as well. Just in case we can't get a hold of them, we will follow up with emails. We also send out faxes out there. Now, just to let you guys know, you shouldn't be faxing anybody that you don't have a relationship with. The reason for that is it's illegal to send faxes to people that did not give you authorization to be able to fax them information. The next thing is, for a lot of the referral sources, contacts that we have their cell phone numbers, we were text messaging them as well, okay? The next thing also is we created several videos. We made videos talking about what we're doing for this whole COVID scare. We made educational videos as well, and we started sending the videos to the referral sources. Now, one thing that we need to do and understand is we don't send videos to referral sources talking about what we can do for patients. What we do is we send them videos on what the process is right now at this very moment, since we can't talk to them or see them face to face, what we should do if there's any referrals. We're giving them guidance at this very moment, and that right there is an important thing. The next thing also is we were sending mails. We were sending them mails, right? We mailed them a card. We mailed them some information. We mailed them a lot of different information that is going to be valuable for them. We created flyers. We created little pamphlets, and we were mailing this to them as well. Also, those pamphlets, those flyers were also saved in a PDF format, and those were also attached in our emails as well. So you guys have to understand is that we're making sure that we're still having some form of contact with these people, with potential referral sources, because of this, because it's an important thing. And communication is probably one of the biggest complaints a lot of referral sources have with agencies, and why they move from one agency to the other is because they don't have good communication with these agencies. And so by us showing that we want to be active, That right there is going to give you guys value, okay? So make sure you guys understand that portion. Now, if you start implementing this strategy, even if you do one or two of them, right, would you be able to see that you're going to be still having that relationship with them? If you're just doing one or two, right, obviously you will. But imagine if you did all of them. Imagine if you did all of them at this very moment. When we talked to the agencies we consult for, they did say that they were making calls, or they were making emails, or they were sending text messages. But when we asked them, did you do this every week on a consistent basis? Their answer was no. And that's the thing that we need to change here, is that you need to make sure that it is done on a consistent basis, okay? So we want to understand that if we're not able to visit these facilities, that does not mean that we cannot still have contact with them. One of the best ways to keep a relationship is also feeding them, right? So we said that we sent them mailers, right? So because we cannot see them, because we cannot visit them, that does not mean we can't send them some food. And of course, it depends on what you're spending. You don't want to spend a lot of money, right? Like, I don't believe in lunch and learns, but that does not mean that you can't send them some food. That does not mean you can't send them some information, some cookies, some little granola bars, right? If we can't visit you, I would rather put a granola bar in the mail and send it to you every day. So every day you're going to be receiving a granola bar, a cookie from me. It's only going to cost me less than 50 cents to send it to you, all right? There's nothing wrong with that. It's going to be delivered. What can you guys do at this very moment that makes you guys stand out? You know, we've done it where we call somebody up and say, hey, I can't visit you right now, but you know, I want to be able to drop off coffee for you. Can I drop off coffee? So we'll use either DoorDash or Uber Eats, one of those companies that we can actually get coffee delivered to them, right? We can't see them, we can't visit them, but that does not stop us from wanting to be able to do something with them. So just because you can't see them or you can't stop by, that does not mean that you can't not give them something else, or send them something, or give them a call or an email, okay? So that's part one. Okay, guys, so in problem number one, where we talked about we're not being allowed to actually walk into facilities, right? We're not allowed to actually do visiting, right? We can't visit or nurture our current referral sources, for example. Or we're moving on to problem number two, where we are going to talk about it's hard to actually gain new referral sources. As a business, as a home care company, as a home health agency, one of the biggest things that we need to do is we always have to get new referral sources coming in. And at the same time as nurture our current referral sources as well. As I shared with you in problem number one section, is that our agencies right now, the home care companies that I own and operate, the home health agencies we have, we're actually gaining more referral sources right now at this very moment. We're seeing a spike actually. And even with the companies that we're working with, we're consulting with, they're seeing a growth as well. And the reason for that is we're going to share with you guys as we go through this whole training. And you have to understand this, right? You will lose some, but you have to make sure you keep on gaining some. So problem number two, it's hard to get what? Not being able to gain new referral sources or even more patients to increase our census at this very moment. And so let's go ahead and share with you guys, you know, what we're doing in our agency that's allowing us to be able to actually gain more referral sources, okay? So, you know, just because, you know, we can't visit, that does not mean we cannot sell our services. We cannot go ahead and offer that to them. We can't do our presentations. As I shared with you guys in problem number one, where we talk about we can't visit facilities, that does not mean that we can't call, right? So because, you know, in this problem number two, we can't get new referral sources, you guys need to be good at handling calls, especially what we call cold calls, meaning that we're calling facilities that don't even know who we are. To be able to be used by a company, number one is they need to know you first, like you, and then trust you. So we can't get a referral source if they don't even know who we are or that we don't even exist, okay? So the importance is to be able to be good at doing cold calls. I shared with you in the beginning of the video when we talk about we're going to be giving you guys a lot of free bonuses, and this is one of the things that we want to be able to provide you guys is that our cold calling training, to train you guys how to actually make the cold calls. A lot of people are going to say cold calling doesn't work, it's not effective, and the reason why it's not effective or doesn't work by these people that say that is because that they did not master the cold call. They actually don't have the skills, the techniques, the scripts, the know-how, how to be able to get past the gatekeeper, how to be able to get that person in the phone that we want to be able to talk to. Now, also understand the cold call, the main purpose of a cold call is to be able to set up an appointment to have a meeting with them. It is very rare that you're going to be able to get a referral from that initial phone call. You need to be able to show them why they want to use your services, why they should value, why do they want you guys to become the preferred provider. So the cold call's goal is to be able to have the meeting. Normally, when we can actually come into a facility and do a presentation, our goal is to make a cold call to be able to set up an appointment with them. But once again, we're not allowed to come into the facility. So what do you do? What should you do? Well, we talked about a video sales video or a video sales letter or VSL on problem number 1. For this portion, you need to be able to make sure that you create videos that's going to allow you guys to present your services. But one thing you should never do is try to get a referral. One thing that we teach a lot of people is that you need to not ask for a referral in the beginning process of things. What you need to do is you need to find out what current problems are they facing. What are 3 things that they're currently, facing with the current agencies that they're referring to? Are there 3 things that, would make them want to make a decision to work with another agency? You need to be able to know and how to ask the questions correctly. And within your video sales letter, your video presentation, you should be able to let them know who you are. Now, there's this thing called email as well. So one thing that we do is that we include email and calls in our follow-up process. So a good example is that if I come into a facility for the first time and visit them, and I do a presentation, I want to be able to find out what are the problems that they're facing, what are things that makes them choose to work with agencies, and at the same time is show up week by week and give them this information. But because right now we can't visit them and follow that up, this is where email is such an important thing. So typically there are 6 to 10 items that we know of the challenge that they're facing. What we would do is that we would send them videos every week included in the email for them to be able to watch. We can actually set it up where we actually know that they watch the videos as well. So this is we can do this through a variety of different ways by using what we call, catch pages or landing pages to be able to measure and find out, did they watch the video? We can also make, specific videos meant for just this one person, this one facility, and we'll be able to see, is that video, has it been viewed? Has it been viewed in its entirety? It allows us to be able to know, can we measure what we're actually doing? And at the very same time as we're going to follow up with phone calls. Hey, just want to be able to know, did you watch the video? Or hey, just want to be able to know, did you get the email where we sent you guys our brochures? So in the emails that we're sending them, we want to actually, number 1, send them links to the videos that we want them to watch. Number 2 is to be able to also provide them with educational-based marketing materials. Now, a lot of you guys are saying, well, Michael, I don't have a team of people that's going to be able to help me create these items. Well, guys, there's this company called canva.com. And this is a company that we actually use ourselves a lot of the times to make a lot of our presentations. And this is something that you should look into, Canva, CANVA.com. And one thing is we want to educate people, right? Give them information about COVID, about social distancing, what are different precautions they should take. And in Canva.com at this very moment, they actually created ready to go, brochures, ready to go flyers that you can use, and you just have to put your logo in it and then do some updates here and there. So take a look at that company. It's a great company. It's really, really good. I truly use it. They have a free version. We use the paid version just because we can get more photos and more designs a lot better. But the free option, honestly, is already amazing as it is. Okay, so take a look at that. And then the one thing that we want to do is, like I said, is we want to be able to kind of replicate the whole thing of us doing a presentation. So just because we can't do a live presentation, that doesn't mean we can't use a company called Zoom or use FaceTime, or we can even use Viber or WhatsApp. Those are things that we've actually used. And if you're really old school, then use GoToMeeting, or you can use pretty much, Skype if you guys are still using that, if you have a Skype account. But we like to use Zoom meetings, right? So what we do is we say, hey, we just need 10 to 15 minutes of your time. Do you have that? If we can get that meeting with them, because we're going to say, hey, we can't come into your facility, but do you have 10 minutes of your time that you can spend with me? I would truly appreciate it. And when they have that meeting with us, then we can go ahead and start the whole presentation. When we're talking to people, when we're in that moment of presenting them our services, one thing you need to do is not present your services, right? A lot of people will say, well, tell me about your company. And you're going to jump in and say, well, we provide quality service, we do this, we do that. That is one thing you should never do. Whenever time somebody asks me, say, hey Michael, tell me about your company, I'm going to say, well, before I even tell you about my company, I'm sure you're aware already what home health is, but before we even get that, let me ask this question. What are 3 things that made you choose to work with agencies in the past? That allows me to find out 3 different things about what their buying criteria is. Then we move on to the next stage and ask them, what are 3 things that those agencies you're working with right now can improve on? What would that be to be able to provide better care for your patients and help you as a referral source? If I ask those questions, I may be able to get 6 to 10 different information that makes me understand them more. And then I will set up my presentation according to what they're saying, what are the problems they're facing, what's going to make them make a choose or a decision to work with another agency. And then that is how we set up our whole presentation. We do that in our live presentations, but we can actually do that as well through videos as well. And then also understand this is actually working really well, and this is one of the things that is getting a lot of our agencies more referrals, is we're letting people know that we are COVID certified, right? Not using the word COVID ready, we're saying we're COVID certified. We can say that we're certified because we certify the fact that we train all our staff about the whole COVID section. We already have policy and procedures in place on how we do our procedures when we do our walk-ins, okay? And when we take care of patients and how we acquire new patients. And so by them hearing this, it allows us to be able to position ourselves that we are of value compared to other agencies that are not saying that. So once again, use the word COVID certified, not COVID ready. Another thing is, through our video sales letters, our videos that we send them, flyers that we send them, we actually give them a description of the things that we do. This is how we handle our admissions when we have a patient coming in now. So previously, when we're visiting patients, okay, when we're visiting patients, the nurse is not wearing a face mask. And so we just follow pretty much proper hygiene, universal precautions. But what we want to do is we want to be able to show them what we're doing. So we actually created a video and show them our step-by-step ways of actually us doing a visit to a patient. Now, obviously in the video that we created, we actually use our staff to kind of make a pretty much act, right? Reenact the whole procedure of us doing a walk-in, making sure that when they walk in, they follow universal precautions. At the very same time, provide social distancing. The nurse that walks in is going to be wearing a mask, and at the very same time is to be able to provide, additional care, additional, support. We also give the patient a mask as well, so that when our nurses, when our caregivers are walking into the patient's house, they are both protected. We're protecting them from our caregivers, and we're protecting our caregivers from the patient as well, just in case, okay? So we show them a video, that's how it goes. Now, it's pretty easy. Like, if you guys can say, well, Michael, I don't make videos. Well, guys, I don't make videos before either, but I've learned. But at the very same time, is if you don't know what to do, you can always find people to do it for you. So we use a company called Fiverr.com. They actually have a lot of people there that are pretty good at doing video editing. And so you can pay somebody $10, $15 to do a video editing for you. And that's going to be able to be helpful for you guys as well. So what we do is when we tell them what we do, we also show them through brochures, through flyers, through video, right? It adds an extra umph to our presentation. So you guys, for example, you guys probably have watched videos on Facebook and YouTube, right? On how to do this, 5 steps to do that. We do the very same thing on a lot of our videos, on our presentations, to be able to show people what we do, to showcase, and not just to tell them, but to show them. A lot of people will believe you more if they can actually see the steps that you're doing rather than you telling them. So that's why we tell them, by words when we're talking on the phone, but we also make sure that they can read it through our brochures and through photos, and then at the very same time is provide video as well. So if you guys can actually do that at this very moment, it's going to be very helpful. Now for you guys out there and you're going to say, well, Michael, I don't have time for that. Hey, look, I completely understand that you guys don't have time, but guess what, guys? It's better now than never, right? And so if you guys need help with that, our company would love to help you guys kind of create those videos if you want us to do it for you guys. But if not, there's a lot of different ways that you guys can actually do this, right? Just let you know my nose is a little bit itchy right now. So anyways, moving on. Let's go ahead and talk about other things that we can do in regards to this whole setup, right? So in problem number 2, like I said, we're not able to get new referral sources, all right? So one thing that you can do is your giveaways, right? So I'm sure that you guys used to give pens, used to give mugs, right? But this is a way to be able to get their attention, be able to say, hey, this is what we're doing. Rather than giving them little, tchotchkes here and there, we actually got ready to go, right? So our team, we had a mastermind meeting with our marketers. We sat down, we said, hey guys, look, this is coming. All this stuff is going on. Don't forget, remember the toilet roll scare, the toilet paper scare, where everybody was like running out of toilet paper. When this was happening, we actually went to Costco and bought a bunch of toilet paper, right? Because we're taking care of a lot of our patients. If they don't have toilet paper, it's going to be a little bit hard for us, right? So, we made sure that we were ready for this as well. Well, little giveaways, right? How do you stand out with your giveaways? So one thing that we did is that we actually gave out, we bought some boxes from Amazon, some real nice, cute boxes, not that expensive. It costs maybe about 35 cents to 50 cents a box, right? And so what we did was we actually put N95 masks in there with our business cards with little notes, okay? And we sent that to all our current referral sources. But at the very same time as we sent it to people that we were trying to get a meeting with. And we told them, and because a lot of facilities were still not closed down around this time, but what we did was we sent them N95 masks and say, hey, listen, we want to be able to have a face-to-face talk to you, and we know that that you're trying to prevent certain things, so we're sending you an N95 mask so that maybe we can meet outside your your facility for a quick 5-minute quick chat. You can put your N95 mask that we gave you, and our company, our marketers will be wearing one as well, so that we can protect each other from from all the stuff that's going on. And guess what? We're not even going to give you a flyer. We're just going to send you a video to watch, right? So by us doing that, that's actually going to become very helpful. So we were sending N95 masks. So that got a lot of phone calls, to come into us. A lot of people call us and say, hey, thank you so much for sending us the N95 masks. And we said, hey, you're welcome. Can we have a meeting? If you don't want to be able to meet up, can I do a quick 15-minute meeting with you guys? The N95 mask didn't cost a lot of money for us. It didn't. Right? So it was a good thing. And then what we also did was we were sending regular face masks, those basic face masks that we have, that not the N95, but just the basic blue masks that we got from Medline. What we did was on a weekly basis, we were sending by mail 3 of those face masks to them, because some of the facilities were running out of face masks, and at the very same time as the facilities were being careful that employees weren't taking things home. I'm a nurse myself. I've taken home things by accident. Yeah, most of the time, right? Tape. Things always end up in my pocket when I used to be working in the floor as a nurse. It's the very same thing at this very moment, but you have limited supplies. So companies are very careful. So here we are sending N95 masks and sending regular masks to these potential referral sources and our current referral sources. So we were giving something of value that wasn't really costing us a lot of money, but we were sending things by mail. So it was another form of us to be able to have follow-up. It's another thing that we can actually solve problems. It shows that we want to be able to help them out. And so what are things that you guys can do at this very moment that's going to make you guys stand out? We were also sending them what we call our care packages, right? We sent care packages. So in a little box, we also provided the masks. We'll put a pair of gloves in there. We'll put an antibacterial soap, antibacterial gel, and some snacks, of course. Never ever send something to somebody without some snacks, okay? So these little care packages that we were sending on a weekly basis to these facilities, to potential referral sources, because we know who we're targeting, it got their attention. So let me ask a question for you guys, right? Is this, any of these things have you done actually? At this very moment, since the COVID scare, the beginning of the shutdown and everything, have you done anything like this that we're doing for our agencies, that we're suggesting for the companies that we're consulting with? I will pretty much say that more than likely you were not. And so this is how you stand out. It gets people attention right away. There was one weekend, this was actually 2 weeks ago, where one of my head marketers came in and said, hey, Michael, look, I know this is going to be kind of dumb, kind of stupid, but let's just go ahead and do this, right? So we ended up buying more boxes again. And what we did was we put toilet paper rolls in each one of the box, and we sent it to people, and it got people to laugh. It got people to, we got phone calls saying, hey, good job, you got my attention, blah, blah, blah. And so we put the little notes like, hey, look, listen, our job here is to handle all the problems for you, whether good or bad. So we're sending you some toilet paper just in case you run out, right? So, and then in the box, right, in the roll, because those individual toilet paper rolls are wrapped with paper around it, right? And we put a sticker there that says, just in case, open for emergency. And so just to be able to, not to make fun of the situation, but just to put an extra laugh in there. Just try to change the mood of the people around us right now. And so these were good things that we did. We did this for people trying to get their attention, and it got a lot of people's attention. And at the very same time as it kept the attention of our current referral sources because we were keeping in touch with them. Just because we were not visiting them on a week basis, we were still keeping contacts through our emails, through our direct messaging, through our Facebook accounts, through our mailers, through our calls with them on a weekly basis. That right there got their attention. And so that is something that you guys need to start thinking and doing a little bit more. And that's why it's important to actually have mastermind meetings, have a sit-down meeting with your marketing team, with the owners, with the other nurses, trying to figure out what are currently going on in the facility. What are you hearing? What are the problems? What can we solve? Those are little techniques that you guys should be doing within your company. And look, if you don't have a whole team to be able to have a mastermind meeting to talk about what you can do, that's why we're creating this video, is to be able to share with you guys some information on what you guys can do at this very moment. And guess what, guys? Just to let you know, it is not too late to get started. There's a lot of toilet paper available now. They sell in unlimited supplies. I understand that. But that's perfectly fine. Like, I actually had a call one time where a patient called us, and actually no, the family member called us and they said, my mom ran out of toilet paper. And I would say, hey, listen, perfectly fine. We got this, right? Because we had a bunch of toilet papers. We brought it to them. And do you know how amazing that family member, that daughter, was telling us, like, hey, thank you so much for making sure that my mom has toilet paper. And we said, perfectly fine, which then gave us another idea, right? And I'm going to share that with you guys later on this is how we actually got more referrals for our home care and even some home health patients, right? So one thing you guys need to do is you need to have strategies, have tactics. And part of marketing is your branding your company. So, I'm going to share with you guys what we did, right? So I was in the Philippines a few months ago, right? And so in the Philippines, and this was before the whole COVID thing, this was like around November of 2019. And a lot of people there wear face masks. They wear face masks. And why do they wear face masks? Well, because, of the dust and everything, right? So a lot of people wore face masks, not just because there was some disease going on around that time, but just because of the dust. But at the very same time, nowadays, they're suggesting to us to do what? To actually wear face masks at this very moment. It's suggested by the CDC, suggested by the president, suggested by the governors to have face masks, have something of a barrier between you guys. So having that mindset and having that thinking before even there was that rule to wear a face mask outside, and not all states are requiring this, but if you guys ever look back in previous history, the Spanish flu, it became the law that people could not go outside unless they wore face masks. So knowing this, we started had an idea and say, hey, let's brand this whole thing, right? You guys gave away what? Brochures. You guys gave away pens. You guys gave away what? Mugs, all these different things. So what we ended up doing is that we contacted a local person that we knew who knows how to sew. And we said, hey, we want something done basic like this, okay? And then what we did was we reached out to some screen printers, people that did screen printing. And so what we did is we created, within 1 week, we had 1,500 masks. So let me share with you guys what we did for a mask. And this is something for branding, right? So if I put this on right now at this very moment, now we have our face mask, right? So for one of our home care companies, we were able to make a face mask with logo in it as well. We gave away 1,500 of them, right? And this was for us to be able to market our non-medical home care companies. And what we did was we started handing these things out in a senior community area. And we were giving 2 of these masks per household. So we gave in 1 week over 1,500 of these masks. And once we gave out 1,500, we already had more being made as well. And what's funny is that people in our areas, in the 2 different states where we had our non-medical home care company, were wearing these face masks. And at the very same time as, guess what? It was branding our company. And then people were asking, hey, where did you get that face mask? Oh, I got it from this company. And when we gave the face mask, attached was a business card, a brochure of what we do, some information about COVID-19, how to prevent certain things. And this allowed us to brand us. These things right here cost us to make less than $1.50 made. Less than $1.50 to be made. One of these face masks, less than $1.50 to be made. But guess what? 1,500 within that first week of us handing those out for free, we were able to get four non-medical, full-time, 50 hours a week, right? Non-medical home care clients. What's funny is that it eventually then got us more patients for our home health, our medical part, because people actually needed services. So they actually asked us to provide the services for them when they reached out to their physicians. So what can you guys do at this very moment to be able to make you guys stand out? Are you guys making these things, right? Making sure that not just, providing these masks, but providing educational based marketing materials. So this is what we call branding. And you need to understand that this is what's going to be able to get you guys. And this is the funny part, is by the second week, we had over 3,000 of these masks being given out all throughout. And it then generated us 27 non-medical home care clients the second week. That right there is pretty crazy. So imagine that you're branding your company. People are wearing this. People are knowing who you are. Now, just to let you guys know, our first batch did not have our phone number, right? That was a mistake that we actually made. We didn't put the phone number. They did have the phone number, however, because we gave them our business card. So that was perfectly fine. But our second and our third batches that we were making, then we made sure our phone number was there. Because right now, people are walking around with our masks, our company, and our phone number there. And they're branding us. They're advertising for us. A lot of people can say, well, Michael, that's kind of messed up that you're using that situation. No, guess what, guys? A lot of people give away t-shirts with their information in there. We're doing the same exact thing. Our goal here is to give these things, to educate. It's not our job to try to get referrals. The goal here is to educate people, provide value, and then eventually see what we can do. Eventually, what we were doing is all our patients for our medical home health agencies are now getting these as well. They get 2 of these each week, right? Each week for the next, the next few weeks, they get 2 of these, a week when the nurse visits them, okay? And this allows us to be able to have some form of a barrier between us. If they actually decide to go out, which we do recommend them to stay at home, especially people over the age of 65, is probably some of the highest rates of deaths right now in this whole system. So we want to be able to kind of slow that down a little bit. So what are you guys doing to brand your company? What are you guys doing that makes you guys stand out in the community? Think about that, right? Always understand, in marketing, in sales, our first goal is to never get a client, right? Is not to get that client, not to get that referral, but to educate. And if we can educate, that's going to eventually lead us to getting new clients and getting us new referral sources. Okay, so we're currently right now in facing the problem number 2, right? Not being able to gain new referral sources. Now on on part 2, or the second portion of this video series on COVID-19 marketing tactics, we're going to be talking about, how to actually take advantage of the COVID-19 restrictions. But so far right now, we're just in the first part of this video series where we're talking about the 5 different problems, right? So on the second portion of this whole video series, I'm going to go further into showing you guys how to be able to make yourself, as a marketer, as a company, stand out from the noise of other agencies, and how to add more value so that you will become the chosen and the preferred provider to be able to get those referrals. Okay, so please keep on, staying through this whole thing. I know you're gonna say, well, Michael, how long is this whole training? Look, I'm trying to give you guys as much information as possible to become successful. So I shared with you guys several things that we're doing right now that makes us stand out, that makes our agency go out there and to be able to, get more referrals. I shared with you guys the face mask thing, right? How amazing is that if you can make that? It's not that, expensive, right? Now, if you guys don't actually, want to hire somebody to do it for you, listen, guys, I remember when I first got into nursing, I actually was making my own scrubs, right? I bought these little patterns that you can get at Walmart, and I bought some cheap, cloth, by rolls, by yards, and I would just make it myself. Now, listen, I actually took a home ec class, and my mom, for some reason, was not a good cook, but she was really good at sharing how to be able to sew correctly, so she actually showed me how to do it. And so that was such an amazing thing. So, you can actually do this on your own. I mean, I can actually make, I actually tried it just the other day using my mom's sewing machine. I was able to make, 1 mask in less than 3 minutes. Less than 3 minutes. Okay, but this is something that you guys can hire somebody to do it for you, and or at the same time as you do it yourself. Or let's say you have some staff members that are not currently doing some work in the field. Maybe you have some staff members right now that can make the masks for you. So I mean, there are different things that you guys can do at this very moment. It's about standing out, and like I said, the cost is like less than $1.50. But the branding portion of the whole thing is the most amazing part. You need to brand your company. That right there is such an important thing. So we're still in problem number 2, not being able to gain new referral sources, right? So let me ask this question, do you have an explainer video? Do you have brochures, right? You need to be able to create educational-based marketing materials talking about isolation techniques, the social distancing, all these different things need to be able to be something that you guys provide. Now I'm going to share with you guys, some numbers that we got in regards to sales, okay? This is pretty much research that was done just on basic part of sales and marketing, okay? It's not just in the home health industry, but it pretty much applies to anything about sales and marketing. They literally say that 97% of agencies never even contact all sources of referrals. Meaning, let's say there's 100 nursing homes, for example, that you should be marketing to in your surrounding area that you provide services to. More than likely, right, 97% of agencies have not contacted at least one time every single one of those nursing homes. 97% of you guys have not contacted every single potential doctors that should be referring to you guys. Now here's an additional statistics, right? 48% of you guys, 48% of salespeople never follow up with a prospect. Never follow up. Meaning that if you visit them once, you never even follow up a second time, right? You didn't make a phone call, you didn't make a second visit, or if you did visit, you visited 6 months later, which does not even count no more. 25% of salespeople, make a second contact and they stop. So let's say you do follow up, more likely you don't come back in the third time. 12% of salespeople only make 3 contacts and then they stop. So just imagine that. If you're willing to do 4 or more contacts, you already beat what? 88% of your competition. So what we teach people in our whole training, right? So we have 10xpatientreferrals.com, which is our online learning platform. We show you guys everything on how you need to present yourself, how you need to be able to follow up, what you need to be giving, what are the mistakes that you might face so that you can avoid it and know how the techniques to get past those things. These are things that we teach you guys. Follow up is probably one of the most important things, and that's why we share with you guys, right? We call, we visit, we email, we text. And we do this on a weekly basis. We send something by mail. We send something by fax, right? We contact you in LinkedIn, contact you in Facebook. If you have Instagram, we'll hit you up there. We'll actually do the legwork for us. It's about making sure that you're doing your research. It's not that hard. A lot of people don't want to do the initial research, the prospecting part, because they think it's hard. But that really is the most important thing. If you miss a step on the whole sales process, that right there, my friend, is going to cause problems for you guys. The best marketing is to be able to have, a strategy in place, right? Let me ask you guys, how many times have you followed up your referral sources? Have you followed up your referral sources at least twice in less than a month? That's a question to ask yourself. If not, the reason why people don't follow up the next time is to say, well, the presentation didn't do well. It looks like they're already referred to another agency. I don't want to go there. Well, guess what, guys? Most people that you're trying to target, right, that is not referring to you guys yet, is using another agency. Your job is to be able to provide value to show them that they should actually use your services, right? So you need to come up with ideas on how to make your company stand out. We showed you guys the mask. We showed you guys what we did with the N95 mask. We showed you guys with our custom masks that we're giving out, the toilet paper technique that we're doing. It was getting people's attention. Remember, people must first know you, like you, and trust you, okay? So the reason why you're not getting referrals from certain places is they just don't know you. And just because you visit them once, that does not mean that they already know you, right? You need to transition them from knowing you, knowing who you are, getting their attention. Now you know who I am. Let me keep on bugging you a little bit so that you can keep on making sure that when you see me, when you hear me, you know about my company. Then I need you to be able to respect me and like me. And then I need you to eventually trust me by me providing value to you so that you want to work with me and refer your patients to me and trust me enough to provide care for your patients being discharged or your loved ones, your family members. That is the main goal that we all need to be able to make sure as a company. Remember, sell last, educate first, okay? So be able to make sure that you have a follow-up system in place. And we want to be able to share with you guys the follow-up system. So once again, that's something that we're going to be giving you guys is our whole follow-up system. That's a bonus we're going to be giving you guys towards the end of this. So make sure you pay attention. So make sure you have a great follow-up system. If you don't, that's why we're here. That's why we're sharing with you guys some amazing information. So now moving on to what else can make you stand out. So here's one thing, right? So I have something in my hand right now. I'm pressing it right now. So it's gonna take a few seconds and I wanna be able to share that with you guys. So this is one thing that actually gets us. So as you guys can hear, what this one right here is a medication button, okay? So what we're doing right now is we're doing a test. And so the main goal for this is to be able to provide value. So this is one thing that we provide a lot of our patients. So let's give it a few seconds. So, okay, so now it's dialing. Hi Joshua, this is Michael. I'm just doing a test, making sure that that this is working. So I just want to make sure to let you know it's a test only.
Okay, so you're just testing today, Michael, is that correct?
That is correct, sir. I'm just testing it right now, making sure that that we are live.
Okay, Michael. And are you testing, there we go, from Andrea's place?
That's correct.
Okay, and that address is still at 2374 Heritage Lakes Drive, Lakewood?
That's correct.
Okay, Michael. Well, it's been a pleasure speaking with you today, sir. If you ever do need help, please just press that button, and thank you for choosing Just In Case Medical Alert.
I appreciate it. Thank you, sir.
Bye now.
Bye. Okay. So this is what they call a medication. I'm not a medication, a emergency button, right? So when we work with a lot of facilities, a lot of patients, we actually offer for both our non-medical and for our medical home health agencies, we give one of these to each one of our patients. And we actually tell that to the referral source. We say, hey, one thing that we value is, just in case for any emergencies, we provide a medical button, right? What's nice about this button right here, and just let you know, this we're using just in case for this one right here, but there's a lot of other companies that offer the same exact thing, and it's not that expensive. It's a $49 for one of these, right? And then what we do is we pay $19 a month for each one of them. Now, if you look at that, if a patient gets discharged, we do is we then transfer it to the next patient that comes in. For our non-medical home care companies, when we get a client, we give them one of these. They stay long with us anyways. Our goal is to be able to have and provide them services, until, unfortunately they start really having problems and they need, to be in a long-term care facility or they actually end up in hospital. But this is just an added value right there. Yes, it's $19 a month. I don't even bother worrying about the $49 for the initial fee for this because it just goes throughout. Okay, it pretty much just cancels out through everything. Plus also, hey, look, it's a tax write-off. It's an expense for the company. So having one of these, when we tell our referral sources, whether current referral sources or what happens is our referral source that we're trying to show value and get them to refer to us, right here alone, if we tell them that every one of our patients gets one of these, it makes us stand out automatically. So do you guys offer one of these to your patients? And just to let you guys know what's amazing about this, it also has a GPS tracker. It also tells us where the patient is, right? Are they at home? Now, of course, you have to have policies and procedures in place and making sure that the patient is aware that there is GPS monitoring. If the patient does not want that, then you should not monitor with their tracking. The reason for this is once a week, we want to be able to know where the patients are, especially we use this typically if we're visiting a patient and for some reason they're not at home, then we'll track them via GPS. But of course the patient will know that this is a possibility that we can actually do. But it gives support for the client, and the patient knows that if he presses this, if they have an emergency situation, that they can get a hold of somebody. But what's really good about this is we set it up where the primary contact is not the relative, it's actually us in the facility, our companies who gets called first if there is a medical issue that happens, allows us to be able to take care of the patient right away, or at the same time as address certain things immediately as much as we can, okay? So, are you guys, using something like this? For our non-medical home care companies, we also tell the referral sources or even the family members, or when we market and do branding stuff, we say that we actually provide the patient a call button. So if you're a nursing home, for example, or a hospital, and you need to get a hold of a nurse, you press the call button for them to come into your facility, to come into your room. We do the same exact thing because our caregivers cannot really be with the patient 24/7. The patient wants to be in their home, have some privacy going on with them. So the home caregiver or the home health aide is going to be maybe in the living room or somewhere else. And if the patient needs, that caregiver to come into their room, they can use a call button. And so we have this call button right here. It's completely different from the emergency button, right? So this call button, you can get it in Amazon for like $29. It comes with two buttons like this, and also comes with 3 plugins. The plugins gets plugged into the electric socket. And so what we do is we put those all throughout the house, okay? So that when the client presses this button, it pretty much is like a doorbell, alerts the caregiver that they're being summoned, they're being asked to come in, So if I press it, I have it plugged in. I have the one base plugged in right now, so I'm gonna go ahead and press it. You're gonna see it light up, right? And then now you hear the doorbell type of song or type of ring. It tells pretty much the caregiver that they actually are being called, and maybe the patient or the client needs some assistance. Let's try it again, right? You're gonna see it's gonna light up when the doorbell goes in. So it's like a doorbell. It could be used actually as a doorbell as well. And we get this at Amazon, or you can buy it at Wish. Once again, it's another write-off for you. Now, when we stop care for these clients, we take it with us. We don't leave it with a client. We can take it with us, sanitize it, and we can use it for the next patient as well, okay? So you guys have to understand, you should come up with certain ideas like this. Is this something that you're using, that you're branding your company to make yourself stand out? Number one, if a patient can't get a hold of the caregiver, what if they try to stand up by themselves and then they fall, right? Obviously, we can't use this for home health, medical home health, because, as nurses, caregivers, therapists, we're not there 24/7. We're only there maybe an hour at a time for a visit for a nurse, hour for a therapist, depending. And so with that said, this is not really going to work well, okay? But if the patient is in the house and they have a family member in there, we ask the family member, hey, do you want us to provide this for you guys? And if they do, then we also provide it as well. These are little things that makes you stand out. And when you can actually show this to the people that you're trying to get to refer to you, that shows value. Imagine this: if you come in and you say you have quality services, you have quality home care, nurses, therapists, all that stuff, I can say the same exact thing, but then I tell them we have this, automatically we stand out against your company. And so that right there is being able to provide solutions. Now, one of the top reasons why patients end up back into the hospital is because it's medication non-compliant with their medications. Whether, they forget to take the medications or just needed to be reminded, right? So what we actually provide, and this is another thing that we do, is we go through a company called medicationreminderprogram.com. And so it only costs us less than $12 per patient a month. And the patient will get a call twice a day to remind them to take their medication, right? That, allows us to, make the chance of them missing their medication a little bit lesser, okay? And it's important for them to take their medication, especially for medical home health patients, right? We're not there 24/7. Even for non-medical home care clients, for example, we may not be there 24/7 services. We might be there only for 4 hours a day, 8 hours a day, 12 hours a day. And so we want to be able to make sure that they are getting a call to remind them to take their medications. Once again, it's another thing that makes us stand out. It's just through a company called Medication Reminder Program. They actually have a deal for home health and home care companies. You can also purchase it individually. So if a client wants it by themselves, when they can go ahead and call and contact them. It's like $20 per client. But if you have multiple patients, so you get a group discount. So that's another choice that you guys can actually do and take advantage, right? Medication Reminder Program. It's such an amazing thing that you guys should actually add. Once again, when we tell a company this, it makes us stand out. That's the goal here, right? When we're presenting to people, and these are things that we share. We have a video talking about medication reminders. We have a video talking about our, call button. We have a video flyer talking about our emergency button that we provide to clients. Okay, so when we are doing follow-ups, we're sending an email once a week. We're going to be sending information about the medication button. About the emergency button, the call button, the daily medication reminder. Each week, something is being sent to them of information that's different from the week-to-week basis. We do this through email, and if we actually can come into the facility, then we'll actually present them this as well. It gives us a reason to come in continuously every week, rather than just coming every week saying, hey, you have any patients for me? No, hey, just want to be able to address, remember we talked about it's important that the patient takes their medications. By the way, in case you did not read, in our folder that I gave you the first time I visited, I want to talk to you guys about our medication reminder program, right? So we're adding more value continuously. So that's one thing that we should recommend to you guys to actually do. Have certain things going on. Now, you can go ahead and tell somebody to call for you, right? But just imagine this: if you have 100 patients, 100 clients, can you call all 100 of them within 9 o'clock in the morning? No. Through medicationreminderprogram.com, the patient will, everyone will get a call exactly at 9 o'clock in the morning and exactly at 5 o'clock in the afternoon. Always, right? And they'll be reminded for that, rather than paying somebody. Yeah, so if you have 100 patients, right, and you're paying $12 a patient, I think. No, but by the time you have 100 patients, it's like maybe about $10 a patient. So, yeah, you're paying $1,000 to get everyone called every single day, twice a day, but that is going to cost way less than hiring somebody to make the phone calls for you. At the very same time as you're guaranteed that everybody's getting a phone call. The next thing is $1,000 a month for 100 patients is not a lot of money, because if you can get 2-3 referrals a month just because you're offering that and makes you stand out, how much is that worth for you? At the very same time as, imagine if a patient doesn't take their medications on time, they miss their medications and they end up back in the hospital. How much is it going to cost you to lose a patient? So sometimes you need to be able to spend money to be able to make money. And at the same time as when you're spending money, using the money in the right situations, the right items that's going to be able to provide value for your company, right? So that's one thing that you guys need to start looking into. Another one that we actually started doing for a lot of our patients is the option of what we call a bidet option. So, with the toilet paper problem, the scarcity for toilet paper, one of our marketers suggested, hey, remember, in Asian countries that they actually have bidets in the hotel rooms. And I remember that, yes, when I've gone to a couple hotels in Singapore, in Hong Kong, in the Philippines, they actually do have bidets in all the hotel rooms, right? So what we started doing was we said we have a bidet program. So we then contacted all potential new referral sources. This is something that we did not go after our current referral sources. And the reason for that is because we already have them, and we were reaching out to them, and it's not like we let them go and let the ball drop that we're not contacting them. But to be able to add value to us is we said, hey, with the toilet paper crisis going on right now, just in case, we can actually offer bidets. It was just a quick, something to make ourselves stand out, right? We put it in our marketing, we put it in our campaign. And the funny thing is, we actually got 2 referrals just because of the bidet service that the family, and this is for non-medical, okay? We got 2 referrals because the family member just loved the idea. And we told the family member there's no charge to you at all. If the patient's being serviced by us on a full-time basis, a minimum of 40 hours a week, we'll go ahead and pay somebody to install a bidet, right? At no charge for you, just in case. And so, we got 2 referrals, so we sent somebody over to Ace Hardware to purchase some bidets. We have about 20 of them in the office right now. It costs us $30 for a bidet. It costs us $20 to have it installed, to hire a plumber to come in and do the installation for us. So it just comes in a little pack like this, for example, and it's a bidet. Helps them clean themselves out, right? In case there's no toilet. But actually, the truth is here, guys. Listen, in America, it's not a necessity, or it's not a famous thing to have bidets in your bathrooms. But to be honest, guys, if you guys really want to have a good wash and make sure you're nice and clean, Having a bidet is actually pretty awesome. I have a bidet in all 3 bathrooms in my house, and I truly suggest that you guys should, maybe invest it in yourself. It's 30 bucks. We looked at Amazon, and we saw a couple for cheap for like $25, but we just wanted it right away. We had 2 of them installed for patients because that was the one where they said we wanted. We got the referrals. One client, we're taking care of them 24/7. The other client, we're taking care of them for 60 hours a week, right? So the cost of 50 bucks for a bidet plus the install, right, was already worth everything for us. We were, that right there alone was profitable for us already as it is, because we're going to get the return on investment, okay? Now, if the patient decides to stop our services, we're just going to leave it there for them. It's an expense. It's something that we can write off. It's perfectly fine. But once again, it makes us stand out from the rest. What are you guys doing at this very moment that makes you guys stand out from the rest? Now, we're going to be moving on to the next problem, and that is, patient referrals are actually going down. So, this is kind of related to the first part where you can't visit, right? And so you can't nurture them, so that you may lose referrals, or you may start losing referrals because guess what? Agencies like mine are coming in and asking and providing value, and so we're getting referrals. So obviously, if we're getting new referral sources, there's a couple agencies out there that lost that referral sources that we just gained. So we're seeing a lot of this where a lot of agencies are saying that the referrals have gone down. One of my best friends who's gone through my own training, and I actually sat down with him and consulted with him and showed him how to market his company. He built up his referrals, and this is for medical home health, right? He started 2 years ago marketing, and he was averaging maybe 5 to 8 referrals a month, and he was happy with that. And within the past year, he's been averaging over 80 medical home health referrals a month, right? And so there was a good 4 months straight before the COVID thing occurred that he was averaging 100 a month. And because of the whole COVID thing that was going on, he actually dropped down to only 70, averaging about 70 referrals a month. Now, mind you guys are probably saying, oh, that's impossible. Trust me, he said the same exact thing. For him, he was happy with 8. But he's doing a good job. But obviously, from 100 average to 70, that's a big hit for him, a big hit for the company as well, right? So for you guys, you need to be able to learn certain strategies to be able to make sure, hey, this problem needs to have something. And we want to be able to share that with you guys. So let's go ahead and move on to problem number 3, which is patient referrals are going down. Now, why are they going down? Why are referrals going down? Well, facilities are moving to other agencies like ours. Doctors, for example, are not seeing their patients due to the patient staying at home, right? So they're not seeing any changes, okay? Hospitals, have slowed down to non-essential procedures, right? And so the patients that were going to get discharged after they had maybe an ortho procedure or had a pacemaker inserted and all these different things, a lot of these procedures are being held up and being postponed. So what's going on right now is we're seeing a lesser amount of patients coming in for a lot of facilities, right? And so we want to be able to understand that what can you actually do. Remember what I talked to you guys earlier about COVID-19 certified and COVID-19 ready, the 2 differences? Make sure you're COVID-19 ready. Another thing that we actually tell hospitals, and this is what got us 2 hospitals in one area within just 1 week. We told them that we were COVID-19 certified. We actually put aside some nurses and say, hey, listen, our main goal is to provide care. If you work in a hospital, guess what? You're going to have to take care of patients that are COVID positive. But we have what we call PUIs and PUMs. A PUI is a person under investigation, meaning the person is maybe showing some symptoms of COVID-19, but is not having a positive result yet, meaning that we're still waiting for their tests. Then we have PUM is person under monitoring. These are people sometimes that got exposed to people that has COVID-19, and now we're just monitoring them to see if they start becoming symptomatic, right? So these are different things. What we're telling the hospitals now is we actually have a set of nurses that are trained, are certified. We sat down and gave them additional resources, and they are actually going to be able to take care of patients. Because patients, just because they show up positive, that does not mean that they need to be in the hospital. So they will be discharged if their symptoms are not as bad. And particularly, most people are getting admitted to hospitals only if they have COVID-19 positive and they actually started having some respiratory problems, some breathing problems. And of course, just like anything in nursing, ABC, airway breathing compressions, airway is such a big thing. If we're having problems with airway, we want to be able to monitor that patient right away. So most times if patients are having airway difficulties, they are going to get admitted. But if they're COVID positive and they're asymptomatic, they're just asked to actually go ahead and stay home and quarantine themselves at home, right? So there are some patients that are going to require some home health services. And so when we tell the hospitals that, hey, we have a set of nurses, a team that's prepared to handle COVID positive patients when they get discharged to home. That right now there made us stand out. A lot of a lot of home health agencies are refusing to take in a lot of patients. A lot of home health are actually not bringing in new referrals. And that's why your referral sources are going down, because you're not bringing in new referrals, okay? You're not solving problems. Whereas us, we told the hospital this is what we do. It got us 2 new hospitals within a week. And now we're in the talks of working and getting another 3 to 4 more hospitals within the next week and a half. Because guess what? Eventually they are going to have to go home. And so because we now are COVID-19 certified as a home health agency, and we're able to show the hospitals what we're doing that's different, that we're willing to take steps, we're willing to spend extra money on, it allows us to be able to stand out, right? Always understand that. And also never ever neglect your base, right? We're always worried about let's get new referral sources when at the same time as we don't even take care of the base. We don't take care of the patients. We don't communicate well with the referral sources. And that's why these people or these referral sources end up to other places. They move on to another facility, another company like ours, for example. So we want to be able to share with you guys what we're doing, what's working for us, right? Now, here's the thing, guys. We don't want to just give you guys the tools. We're giving you guys the ideas. We're giving you guys the little strategies. But the most important thing is to know how to the tactics, not just the what, but the how. So we want to be able to share that with you guys as we go through this whole video series. So remember, COVID certified, not COVID ready. At the same time as let people know that you guys are ready to handle these type of patients. So guess what? We're getting these hospitals who sometimes never gave us the opportunity to have a presentation. But the moment we saying we're willing to take your COVID patients that are being discharged to home, we got their attention automatically. But what's funny is this. The 2 new hospitals that are referring to us now, that want our services, want to work with them, they haven't sent us any COVID patients yet. But they sent us a lot of Medicare patients, which is an amazing thing. And actually, we even got 1 home care client from them as well. So these are the things that you guys have. Listen, offer services, right? Make sure you're able to take those services, right? And at the same time, is take care of your staff. Take care of your staff, right? So when we talk to our staff, we chose certain nurses. We say, hey, are you willing to handle COVID patients? Some said no, some said yes. Perfect. If you say yes, this is what we'll do for you. We'll provide you more pay. It's hazard pay, right? We're going to provide that for you. We're going to provide you more supplies so that you're always supplied. You're going to have a higher amount of stock guaranteed because you're going to be facing these type of stuff. So we are trying to be ready by being that home health agency, the certified COVID-19 home health agency, or even the certified COVID-19 home care company, non-medical. That right there shows that we're providing value that other agencies are refusing to do, which prevents us from having our referrals to go down, but actually help us to get our referrals to start moving up. And that's one thing that we want to be able to do, right? Is how to be able to stand out, right? Now, moving on, like I said, most agencies are refusing to do what? Admit patients, right? Not just COVID patients, but most facilities are saying, okay, listen, let's go ahead and, just stop bringing in patients. Let's just, let's stop what we're doing. Let's fall back a little bit. Let's just retreat a little bit. Let's not bring in more patients. Well, guess what, guys? Just think about a graph, right? We start, those little graphs that goes up and down. Anything that shows a plateau, right? If there is no, ascending graph, if you hit a plateau, it's just going to go down. So looking at that procedure-wise, thinking about that, our goal is to always keep on growing, okay? So we don't want to scale back. We want to attack forward as much as possible. But a lot of agencies right now are scared to actually bring in patients. The thing though is most of the time people are scared because people are just not informed correctly. And so if you're able to explain to your staff, explain to people and educate them, that removes the fear a little bit, or it eases the fear to a minimum size rather than large size that causes problems. Another reason why a lot of agencies are not being able to bring in more patients is because we're seeing a lot of call-ins. People are scared. I truly understand that, right? Like for example, there's a nursing home in California as of today. They had to emergency remove all their patients at that nursing home and move them to other homes because the staff just actually stopped coming into the facility. They were scared because the facility had over 20 positive COVID patients. 5 staff members became positive as well. And so there's the fear that's going on right now, and I truly, truly understand it. Hey, I wouldn't lie to you guys. I'm scared myself, but I'm just making sure that I protect myself as much as possible, but at the very same time as protecting my staff. We are essential services that we need to provide care. We're taking care of the older people, right? We're taking care of the people who are most likely can be affected the most when it comes to this COVID-19 scare that's going on, right? Because 60 plus, people over the age of 60 and over have the highest mortality rate if they acquire the COVID-19 virus. So a lot of staff members are calling in, and if you don't have a lot of staff members to provide care, guess what? You're gonna lose patients. You're gonna lose clients, right? If you can't properly staff them, what ends up happening is you're gonna have to discharge some of your patients. And I guarantee you guys, most home health agencies, most home care companies, unfortunately, our employees are part-time workers, especially in the medical home health industry. Most nurses that are working in the home health industry are working part-time. And so most likely their facilities providing lots of overtime, better pay. And so they're maximizing their time over there, or they're minimizing the amount of contact with potential patients with COVID-19. So either or, we're losing our census is going down because unfortunately we can't bring in more patients. And when somebody's trying to refer to us and we don't have nurses or therapists to staff these facilities or staff these patients, that's going to cause problems in our referrals, and they're going to jump ship to the next company. And so by us, for my company, for example, we were prepared for this. We prepared our staff. Like even before the shutdown happened in New York, a week before that, we already had 3 days worth of meetings with our staff already. We had a live one meeting with the team, and we also provided video training as well so that we wanted them to be prepared in what needs to happen. We made videos on how we actually wanted them to do the walk-in when they go in to see a client or a patient. And we prepared them as much as we could. We told them that we're here for them. We told them that, hey, if you have any questions, give us a call. If you have a problem 24/7, if it's 2 o'clock in the morning, give us a call. And which leads me to the other thing is, we actually, for you guys as a home health agency or home care company, do you guys have a call center that answers your phone calls? Because I know you're guys going to have the, MOD, your manager on duty, who's in charge of that phone at nighttime, but I'm sure most of the time that person doesn't pick up the call because they're sleeping themselves. So I truly suggest that you guys actually use a company that's going to answer your phone calls. Like I can recommend a company for you guys, Home Care Answering Service, or you can use any other companies out there as well. It doesn't really matter, but you should actually have somebody that handles the phone calls. And we want to be able to make sure that we offer our staff members that availability. You have to support your staff. You can't all of a sudden burden them with this scary situation and then all of a sudden not support them. So, our staff members, we make sure they're supported well. We make sure their family's taken care of. We make sure that their family members have supplies also. Like when we had that live meeting, we actually gave each one of our staff members, a package of 6 rolls of toilet papers. They all got that. They all got their face masks ready to go. So we were reading the the changes, right? We knew something was spewing. We knew something was going to happen. If you guys remember the H1N1 scare, the SARS, all that stuff, a lot of people were just so scared of that. And at the same time, as in the US, we didn't really pay attention much to it because we all thought that was an Asian thing. That was something that was happening in Asia. But one thing that really got me was that I saw this movie a long time ago called The Contagion, and that kind of scared me as it is. And I told myself, is this going to be what I think is going to happen? And so we just prepared ourselves, right? So, we also, made sure that our patients were taken care of, our non-medical home care patients. We made sure that, we sent bottled waters to them, we sent some care packages to them. We worked with the local, food bank as well for a lot of our medical home health patients that could not afford food or could not go out to do shopping. We also told the non-medical portion of our home care company, we told family members, we told potential new referral sources or new patients or new clients, and we said, hey, we also have we do groceries because that's part of non-medical, right? We do groceries, but we don't want the client to go with us. Typically, we want the client to go with the caregiver to the grocery store, just and additional activities of daily living. But with what's going on right now, we don't want our seniors going out. So how do we solve this? Well, for example, our home care company that's in Florida, we use a company called Publix, right? Publix is the famous grocery store in Florida. And they have a app where you can buy the food for the patient and have it delivered to their house. So we actually just do that for the client. We pay for it, and the family member reimburses us for the expense, and we can show them how much we spent and everything. And so a lot of family members who are far away, they don't mind us doing that for them. We want to be able to make sure that how do we stand out? Can we solve certain problems? How can we educate the staff, the family members, the patient themselves, the referral sources? That's what's going to be able to make ourselves stand out, which pretty much helps us avoid seeing our census go down, seeing our referral sources go down. When we can actually provide more value, addressing certain problems already as it is, you might as well be safe than sorry type of a situation, type of a mindset. That right there allows us to become successful. That allows us our referrals to go up instead of our referrals to go down like most agencies that we're seeing at this very moment. Okay, so now we're going to be moving forward to problem number 4 that a lot of agencies are facing right now at this very moment because of the COVID, crisis that's going on, right? So the 4th problem is current patients are canceling services. And we're seeing this a lot right now, okay? So on the previous problem number 3, we talked about patient referrals are going down. Now we're talking about, your current patient census is dropping as well because a lot of people are canceling their services. And we're seeing this a lot because, remember, everybody's so fearful about this. The last thing they want is outside people coming in. So let's say, for example, you're a home health agency, a medical home health agency, and, you're bringing in nurses, you're bringing in therapists, you're bringing in social workers, you're bringing in home health aides, home visiting doctors to this patient. A lot of patients are really scared on what's going on. And so they're trying to prevent people from going to their house to bring in bad things. Just like, for example, nursing homes preventing people from coming into facilities, such as visitors, patient family members, or even at the very same time as, social workers or marketers like us, for example. Okay, so the 4th problem is current patients are canceling services. Or if it's not the patients, it's their loved ones or family members are canceling services because they are just trying to prevent from people to going into their household, okay? And that right there is really, 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 really understandable. You can understand what that's going on. And so what we need to do to control that is we need to be able to address things. And this is where education happens. Sometimes, a lot of people get bombarded by all this different information coming in from CNN, MSNBC, coming from Fox, all these different networks, YouTube as well. And the thing though is if we can actually give them an education, if we did this early on before everything started happening, we could have prevented the loss of potential current patients, okay, or the current clients that we're servicing. So your agency needs to do a really good job on providing education, providing information so that the people that you're caring for, especially their loved ones, are aware that it is more important that we are providing care. Because us coming into the patient's house, us providing services for them is what's going to be able to make them understand that they need us as a frontliner to be able to, first of all, pay attention to potential symptoms that are happening, providing care, because a lot of doctors, for example, are not allowing people to visit their offices no more. Okay, so that's the thing that we need to try to prevent. So number one, everyone's scared. And so the reason why people get scared because they're not educated. And if we can provide them education at the same time as provide them step-by-step things that can prevent certain things from happening, allows us to be able to, number one, provide great care for them, and at the same time is lessen the chances that they actually cancel our services. So what are you guys doing right now to educate people? Right? What are you doing right now to educate the family? And so this is where your team in the office, this is where your nurses, your caregivers need to provide some great information. So other than providing information towards your potential referral sources, you need to also make sure you take care of your base, your current patients, your current family members that you're servicing as well. Because we don't just serve the patient, we serve the family as well, the people that live in the house as well. So this is where we provide care packages for the patients, masks. We provide antibacterial soap, antibacterial, the hand sanitizers, right? You need to be able to make sure that these are being provided, as well as giving them instructions, okay? So we actually did a study, and we actually asked, all of our patients that we're servicing, and as well as family members, and we found out that typically the average person only washes their hands, in average, about 0.75% at home, okay? That's what we were seeing. This is, of course, not including the fact that they took a bath, right? And so this is where, talking about hand washing is such an important thing. And the worst part about it is that there's all these educations about, hand washing that they actually don't, they tell you how long you should wash your hands, but they don't specifically teach the people how they should pay attention on washing their hands. What are the different procedures that they need to do? And so this is where we take it to the next step of providing education, providing videos. So our nurses, for example, our caregivers, other than the fact that they teach the patients, they tell them what they need to do, by providing them with videos on how to do it correctly, they can actually show this to the patient. And then at the very same time, part of the education is return demonstration. Can they return demonstrate that they know, and they can actually follow through with the knowledge that you're actually providing? Now, one thing that we actually did was this, is that earlier on today, I explained to you guys about our medication reminder program, where we use a company called medicationreminderprogram.com, and they call the patients every day to remind them to take their medications twice a day. They call them at 9 o'clock in the morning, exactly 9 o'clock in the morning, exactly 5 p.m. every day. And the cost is less than $12 per patient for the whole month. It's worth that. But we actually talk to them and say, hey, can we do something about about additional reminders? So the company, what they're doing now is they change the call, and then within the call, it reminds the patient to wash their hands. So other than taking your medication, reminding them to take your medication, we're also reminding the patients at least twice a day to go ahead and make sure that they wash their hands. Because the number one prevention on the whole COVID spread is to actually wash your hands and to prevent your hands from touching your face, because we want to prevent any transfer of the virus if it is present in the patient's home. And that right there is an important. Fear normally happens when people are either not ready for something or don't have enough information. And if we can actually give them the information, it prevents them from actually reacting late or panicking from something that they are not fully aware of, right? So we want to be able to make sure that they're not canceling their services. Providing educational materials. We actually make sure that we do live calls coming from the office, checking up on the patient. Are there certain things that you need? Are you lacking certain things? Is there something that we can help you guys out? What can we actually do? Okay. An additional thing that we actually provide, we talked about earlier that we provide, the call button for the patients. We provide them with a emergency button such as this that's rechargeable. And once you charge one of these, they can remain charged for up to 3 days straight without recharging, which is an amazing thing. It comes with a clip, or also comes with an attachment that can be a necklace, right? Another thing we do is for all our patients is that when we do the assessment, we find out, do they have a smartphone, for example? And if they have a smartphone, we tell them to download a certain app that we kind of use within the facility, and they will have a direct number to us. So what happens is our office team, our office staff in our office, they're able to have a face-to-face time with our team in the office at the very same time as if it's off hours. We can have our call center that answers the calls for us 24/7, relay with the manager of duty that the patient wants to have a face-to-face talk. Being able to speak to somebody in the phone is an amazing thing, but imagine if the patient can actually have a face-to-face time via video, that they can actually be more comfortable and it gives them more assurance. So all our patient has the capability to not just give us a call, but to actually have a video conference with us. If the patient does not have a smartphone, that's when our company provides one for them. Now, it's provided only to them during the service that we provide. So after, let's say, for example, a 60-day, a 60-day service for our medical home health for a patient, after that, if the patient's not readmitted, we actually take the phone away from them or the tablet that we use. It's just there for the purpose of that. And of course, the patient is made aware that they can't make any outside phone calls with these particular phones because we set it up where they can only call 2 numbers, which is the office or the on-call number, or they have the app that we tell them to download, and then they can call somebody from the staff. So that right there provides amazing services, having that one-on-one feeling where, number one, the patient feels comfortable. Having that person, a live person on the other line, other than just hearing their voice, is going to be able to bring additional care for the particular patient. This is also something that we set up where the physician, if the patient wants to speak to the physician, they can talk to them as well. And that's such an amazing thing because now we can have physicians talking to the patients as well. Now, the medication reminder is an important thing. Reminding them every day to what? Not forget to take their medications. And if they have such a thing, once again, it adds more value for your patients. And at the same time it's educating them. So we talked about the FaceTime talk, right? Whether they're using a certain app, if they have FaceTime, if they have Viber or whatever that you guys want to use, we use a particular program in our company. It's through RingCentral. Then they use actually the Zoom services. We can also do FaceTime if the patient prefers that, or we can also do pretty much through Viber video messaging. Another thing is, other than the patient being able to speak to us, okay, and somebody from the team, the patient can also have a chat with their loved ones. This allows us to be able to provide that connection because the patient's scared. Sometimes their loved one doesn't live in the same city, doesn't live in the same state. And so by us providing the patient who doesn't have a smartphone a capability to be able to speak to their loved one via video chat, that right there is such an amazing thing. And that also, it keeps the patient occupied as well. So if the patient wants to use the phone that we provide, if they want to, then they can speak to their loved one. Of course, we tell the loved one that they have to actually download the type of program that we want them to use. And so this allows a connection, right? So you guys have to understand is we want to prevent people from actually, number one, canceling their services because there's a higher problematic chance that something's going to happen to them if we're not providing the services. The fact that they need caregivers, the fact that they need home health nurses, skilled nursing, skilled therapy, it already says that they are in a population that's at risk. And so we want to make sure that they stay at the comfort of their own home. Now, if we're going to keep on talking about certain things, I also want to tell you guys that you need to train your staff. And how to train your staff is to be able to, number one, know how to answer the phones, right? So what we did was we did a return demonstration. We did a one-on-one with our staff so that we could see, are they able to handle certain calls? We also did this with some people, other agencies that we're working with. And so what we wanted to do is we gave them a basic scenario and we just role played it. So if if somebody calls, let's say I'm going to be a patient, right? At this very moment, I call, right? And one of my nurses answer and say, hi, I'm really scared. I need to cancel my services. I'm scared about this whole COVID thing. My nurse on the other line needs to be prepared, right? So typically, some agencies that we actually did one of these role-playing things were answering the wrong way. The way they were answering was they were saying, no, don't cancel. We want to be able to come visit you. No, I don't. Then the patient will say, no, I don't want you to come see me because I don't want you bringing the COVID. And so you have to go back and forth. So the best way to handle if a patient says that they want to cancel and you say, hey, tell me why you want to cancel. You want to address their problem. The biggest mistake a lot of people makes is that when somebody says something and the person answering the call doesn't like that, they automatically tell them that no, they'll automatically tell them that you shouldn't do that. And when we do that, that creates tension, and then that other person will lose rapport with you. So we always want to make sure that we address, every time somebody brings up a problem, address the problem. Hey, listen, I completely understand why you want to cancel your services. Before you cancel your services, can you tell me more of what's going on? Because we want to be able to address the situation and then give them a solution. So you have to be able to control your team. If you guys want, we can do one of these role playings with you guys, and we would love to be able to help you guys out to minimize the chance of you losing some not referrals, current patients, and them canceling. So this is just another one of the problems that a lot of agencies are facing right now. Like for you, for example, are you guys facing where a lot of patients canceled services because of them being scared about the whole COVID-19 problem or the COVID-19 epidemic, whatever you want to call it? I'm sure that if you haven't experienced this, you might get it soon, or if not, you already heard other agencies that has had this particular problem. Now, let's move on to problem number 5. Problem number 5 pretty much is cash flow. Because we're losing patient referrals, because we're losing, our census are going down, at the same time as we can't bring in more patients because a lot of our nurses are canceling or calling in sick. Right now, what's going to happen is we're going to have a cash flow problem. A cash flow problem is probably one of the worst death sentences for a lot of agencies. Most agencies are already suffering right now, even before the whole COVID scare. And it's not just, our industry, the restaurant industry, the retail industry was losing even before the whole COVID-19 scare. And then now with this stuff happening, a lot of companies are said to go out of business soon, right? And a good way to look at it is look at Sears, look at Kmart. These companies are losing already a lot of revenue. It's going to happen also in the home care industry. And it's going to happen to a lot of agencies that did not prepare correctly or is not preparing to handle certain things as we move forward. Okay, so with losing patients, we can't get more referrals, lesser referrals arriving, staff members calling in. Guess what? Our cash flow is going to go down. Cash flow to companies will begin to cause problems. So I want you guys to pay attention. Are you guys starting to see maybe some cash flow problems? Maybe you guys do have a reserve, right? If you don't have a reserve, that's going to cause some problems later on, right? We are essential services, but at the same time, if this continues, imagine what's going to happen. Maybe you have a stockpile for the next month, but imagine if within the next 3 months, our cash flow dwindles. We're not bringing in new referral sources. We're losing current referral sources, right? So imagine what's going to happen to a lot of agencies 2, 3, 6 months from now on, right? And so also understand with a lot of patients, if they can't work, the patient's loved ones, if they can't work, how can they pay for mom and dad or grandpa, grandma services? So they might start canceling certain things. So cash flow goes down. If people are not working, how can they pay you for the services that you guys are providing? So guess what? Things are going to be missed. They're already saying that, people are not going to be able to pay their mortgages on time. People are not going to be able to pay their car payments on time, their insurance on time. So imagine that. How about the services for mom? Services for grandma, for grandpa? They might not be able to pay for it on time, right? So we have to be able to be ready for this. And the best way to be ready for cash flow problems is to go all in, is to be able to market and bring in more referrals. The solution even before has always been marketing. Would you agree that marketing is 100% of our profits? Right? Would you agree? Marketing and sales of our home care, our home health services to people to start referring patients to us or start using our services is 100% of our profit. Yet most agencies don't even have a budget, a specific budget in place. And some agencies don't even have a marketing team in place. It baffles me when companies will tell me that they don't even have a marketer. And an owner who runs the company, who's an administrator, does payroll, says that, well, they're the ones that markets their company. And when I ask them, how many times a week do you market? They say once a week. Well, that's why you're having problems right now. That's why you don't have enough patients coming in. Because if you're only marketing once a week, that's not going to do well for you, right? Marketing is 100% of your profits. Henceforth, you should have a 100% ready to go marketing team out there. And at the same time as most people has a marketing team, but they don't provide them enough information, enough education on what they need to do to be able to market their company. So If I ask you right now, what's your budget for your marketing? And if you tell me it's $500, then we're gonna have a quick conversation really quick and figure out how can we spend that $500 to maximize everything, right? And so, what's your current marketing budget? You have to know this. You have to have something specific, because if you think that you can create a plan without really, if you think you can just, start marketing out there without a plan, that's going to cause problems. And everything starts with expenses. And we need to be able to make sure that we have a budget set in place for our marketing, because that's what's going to show us improvement. The main solution for any cash flow problems is to get more patients. And for this to happen, it's to market your company nonstop out there, right? That's what you guys need to do. If you consider marketing as an expense to you, if you think marketing is an expense and it's not an investment, then it's time to understand that your business may eventually fail. Because I don't look at marketing as an expense. And the reason for that, it's because I'm investing in my company to get more referrals. I'm going to invest on training for my staff. I'm going to invest on things that I can make sure they have to provide, like tchotchkes, giveaways. I'm going to invest into it, making sure I bring in new marketers, right? If I want to, if I have 4 marketers, which I do right now for my one agency, and they're getting paid $60,000 a year, right? And they're allowing my company to have an average of about 150 monthly census, right? If I want to have 300, then I need to start looking at what? Bringing in another 4 more marketers within the next year. Now, understandable that I can understand the fact that sometimes you're going to bring in marketers that are really not going to want to learn, that are wanting to do their old ways but doesn't have good results. You're going to have to get rid of them. Our belief in one system is this, is that you hire fast, but you fire faster. If a marketer can't prove themselves, get rid of them, because that's a waste. That's an expense. An expense is somebody that you cannot multiply your money. An investment multiplies your money. An expense takes money away. It doesn't make you money at all, right? So that's why marketing is an investment and it is not an expense, all right? So with what we shared with you so far, to be honest, with what we share with you so far, what is rolling in your head? What gears are turning in your head that you want to say, I want to have this for my company. I want to start doing this, whether it's a medication reminder program, or whether it's the, medicationreminderprogram.com or the Homecare answering service.com, services, or you want to start using one of these, call lights to try to get people to want to refer patients to you, or a medication, emergency medical button, or using the medication reminder program, right? Whatever you want to do, right? Whatever you want to do. Which one is really hitting your head that, oh, you know what? I need to start doing that at this very moment. You remember, one of the biggest resistance in success is procrastination. Sometimes we come up with a good idea, or we hear a great idea, right? And we say, you know what? That's going to work. But then we procrastinate and we eventually not do it all, and it's too late. So I want you guys to understand that the longer you wait on taking action will cause more problems to actually occur. I hear it a lot where marketers and even agency owners will say, I actually thought of that first. I actually wanted to do that. I wanted to do telehealth. I heard about that. I wanted to do that a year ago. I was planning to do that. I wish I knew this earlier. All these things that we hear is that I wish I did this. I knew about that before, but I didn't do it. And that's the thing, it's procrastination. And we need to stop procrastinating and create action. When we started hearing a lot of people saying, hey, Michael, we need help with this COVID problem. We have a problem. Hey, that's perfectly fine. And that's why we went ahead and made this training video right here, right? We're creating action. We're doing this right now. We could have waited, 3 months, April 30th, wait till the whole COVID thing is over, then make this video. That's completely true. But then what is it going to do for us? We want to be able to help out companies. Our goal is to provide education. Remember, I told you guys, we don't want you to ask for a referral. We want you to educate people, provide value. Just as we're providing value with this. Like if you're watching this video and you're not even one of our clients that we're consulting with, hey, perfect. I'm glad I can help you guys out. But if I can do anything else later on further, I want to be able to do that as well. I want to become the person of choice for you guys, to be able to provide you guys information, to be able to help you guys succeed even longer, right? Now, you have to understand, thought is instantaneous, right? I want you guys to think about this. Procrastination is a killer. but thought is instantaneous, right? And if you don't ask and act immediately, more likely you will be too late. And it's not too late yet. You can still do those mask things. You can do the N95s. There's not a lot of shortage. You can purchase those at Home Depot, right? You can have the masks made. You can start making all these different educational-based marketing materials in Canva.com. Or if you want to hire somebody to Photoshop for you, you can do that as well. A lot of people, say, well, I can't do that. Of course you can't do that, but that doesn't mean you can't hire somebody that can do it for you. And we need to be ready and act now. And if you can't act now by yourself, you can't find the proper people, then just give us a call. We want to be able to help you guys out. Just to let you guys know, keep on watching this video series. That's our main goal, because what we're doing is later on, you're going to have the ability to be able to join us at one of our mastermind meetings where you guys can actually ask me and my team live questions. We're going to be live for you. You guys can ask as much questions as you want for the 1 hour that we're there. And we're going to answer a lot of your questions. And most likely, if you have a certain problem and you have a question, the question that you're going to ask is the same thing that another agency might ask as well. And we want you guys to join us in these calls, right? So we're actually going to give you guys a link that you guys can join us on our live Q&A session on marketing, especially. And you can talk anything about marketing other than just what's going on with the whole COVID-19 scare. But we want to be able to talk to you guys and give you guys as much added value as possible. So let's keep on watching the video, and we're going to be moving on to the part 2 section, right? We just literally went on the whole part 1. Part 1 so far, pretty much is the longest part of this whole training series, right? We have 3 parts. Now we're moving on to part 2, and the part 2 is how to be able to take advantage of the current situation and to beat your competition, right? So let's go ahead and move on to part 2. Okay, we are now in part 2. Part 2 of this whole video series about COVID marketing, or marketing during the time of a COVID-19 epidemic, problem, whatever it is, right? So we're in the part 2 of this marketing video series, and in part 2, like we said earlier on in the beginning, part 2 is all about how to take advantage of the current situation. If you've been watching and paying attention on the problem, the 5 top problems that agencies are facing, I probably shared with you guys already certain things that if you guys take advantage now and create action right now and start using those techniques, well, guess what? You're going to see success in your marketing and you're going to be able to take advantage, okay? But here's the thing. Let's put a more emphasis on the taking advantage and why at this very moment you can take advantage and really, 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 really create a successful agency, especially at this very moment, okay? So by now we shared with you the top 5 problems that we are facing with during this time, the COVID-19 restrictions, the stay at home, the social distancing, right? I'm starting to stutter here, I apologize. And we shared with you guys actually how to solve the things easily with those problems. Because the last thing I want to do is just talk about the problems and not give you guys solutions. And I literally gave you guys a lot of solutions already that my agencies are using at this very moment, whether it's the companies I own or a company I partially own, and at the same time it's the companies that we consult for. And we are actually working with over 500 agencies now that is part of our 10xpatientreferrals.com membership. So, and at the same time as we also have close to about over 100 agencies that we consult for where we manage their marketing team. So, hey, we want to be able to help you guys. We are hearing the front lines. We are hearing people that are facing these problems. We are hearing from them and we're giving them the solutions. We face the problems ourselves and we actually sat down and said, hey, how can we create the solution at this very moment? Let's just not, just sit here and just, lollygag and just be like, oh my God, there's so many problems. Look, there's problems everywhere. I always tell people one thing, I would rather have new problems and find the solutions than keep on facing the same problems every day. Good example is a lot of agencies face the same problems every month. They don't have enough patients. They don't have enough referral sources. Their cash flow sucks. And then when they get hit with such a recession right now, something like this restriction with COVID-19, it causes them more pain and more problems, right? And they still have that one problem that exists, cash flow, not enough patients, not enough referrals, okay? So let's move on to the next stage. That is how to take advantage of the current situation. Now, if you have not watched part one, if you guys decided to like, let me go forward, let me skip certain things, I truly suggest that you start from the beginning and really watch this all the way through. You don't want to be skipping steps. You don't want to be missing certain things because you'll be surprised if you skip on some things. Maybe there was a golden nugget that you could have used that for your company. Maybe there was a problem that we solved for you that you're facing right now that you missed. So if you literally skip from part one and jump straight here, I truly suggest go back to the beginning and watch that. And when you're done with this whole training, you need to be able to make sure you watch this several more times. And the reason for that is this whole training is going to be out the door. It's going to be taken away. By the time you watch this, I'm going to tell you that you probably have less than 7 days and we're stopping this whole video training because we want to keep it very limited and we're going to put it into our membership page where people can access only who are members with our company. All right, so I truly suggest that you start in the beginning and you go all the way through and you just go ahead and keep on repeating them until it really just drives down in your brain and in your system that you need to do and create action right now. Now, always understand that during the time of any recession, it is the best time to actually double down. Some of the most successful companies, most successful businesses, whether it's in our industry or outside, came about during a recession because there were problems that were occurring and these companies created solutions or took advantage of the market, right? It's the companies that can adapt are the ones that will actually succeed. That's why we should jump on this at this very moment, and you really need to take advantage. So how do we take advantage of the COVID-19 shutdown? Well, let's share a few things. A lot of agencies are going to stop marketing because they don't know what they need to do. They don't have a solution. They didn't create a policy and procedure in place. So imagine that. Remember we shared with you guys, that 97% of the agencies have not even seen 100% of the potential referral sources. Like if there were 100 agencies, right, and there were 100 potential nursing homes, for example, only 3 agencies actually saw all of those 100 nursing homes in that area. So, and the question is, are they good at their follow-up? But here's the thing, because of this problem at this very moment, a lot of agencies are, number one, they're going to stop marketing. They're going to stop following up because they don't know anything else. And so when that occurs, when that step back happens, that is the moment that you as a company need to go full forward because people are stepping back. And now it's time for you to jump forward and go after the potential referral sources that they're missing, right? And so a lot of agencies, they're marketers, for example. So, other than the agencies, the marketers are going to stop marketing or they're going to be stuck because they don't know anything else, right? Or a lot of times it's because there's this scarcity going on. People are scared, right? People are nervous. Then they might start getting rid of some of their employees. They want to save money. Like, oh no, we don't have enough money. That's the thing. Remember, I shared with you guys, the number one thing to solve problems in this industry, right, on cash flow, if you don't have enough money, is to market. Market is 100% of your profits. Yet we don't do marketing a lot, right? And so when times like this happen, like, oh no, money is going to be scarce. Let me save some. How do we save money? Okay, well, let me fire this marketer, or let me stop paying this. And guess what? For some reason, we see this a lot. When a lot of agencies want to save money, they fire the marketers first. I would rather you fire the receptionist rather than the marketer. Because the marketer is the one that's going to get you the patients. That's just the complete truth. The marketer, or you marketing, a good marketer, is the solution for the problem of cash flow. So, when your marketers are stuck, they don't know what to do, or you decide to stop marketing because the only way that you know how to market is to walk into facilities, well, right there is a problem. So you as an agency, knowing that other companies are doing this, now it's for you to jump into this mix and go full forward. If they took a step back, you take 2 steps forward, or even 3 or 4 or even 5. You go all in. That's the way to do it. But here's the thing. Just because I'm saying go all in, don't tell me that all of a sudden you're going to hire 5 marketers. If you have the budget for it, go for it. But here's the problem. Are the marketers you're hiring, do they have the skills? Do they really know what they're doing? Do they have the training involved that they need to have so that they know what they need to do? So a biggest mistake that a lot of companies make is that they hire marketers who say they have experiences, but then the truth is they don't. Or they may have experience, but they have the bad experience and they don't know really what they need to do. So always make sure just because you're gonna step forward, 3 steps forward, go all in, you have to do it also with caution and also be prepared. Don't just jump in blindly. Be prepared on what you need to do, right? And a lot of agencies, I've seen several agencies that decided to just close down. They closed their offices, right? And then they decided to just take care of their current, their current patients. But guess what? Now all of a sudden they have patients that stops quitting, that cancels services, doesn't want their services. Then if an agency, for example, like a home health is using an agency that provides therapy services, but then they don't have enough therapists, then all of a sudden now they can't provide the care, billing goes out the door, patients or the home care patients, non-medical private duty ones are not paying on time. All these things are gonna start happening. So when companies out there, there's going to be companies out there who are not prepared, that's when you pounce in. It's like when the stock market, people, because of the stock market going down, right, people are selling off their stocks. When the real investors are saying, whoa, now's the time to buy stocks. Because when it goes up, guess what? I'm going to make profit. Imagine if you bought stocks when it hit below 20, right? If it hit below 20, but then within a matter of a week, it went back up to 23, right? There's that big portion that you can make profits on, right? When everything goes down, that's the time to invest and go all in. And that's what we're just trying to share with you guys, is that now is the time to actually what? Go all in, right? And that is what's going to really give you guys success. That's what's going to be able to get you guys where you need to do. And always also understand that you're dealing with a lot of agencies, who are out there. They may have marketers, but they're really not marketing full time. Like I shared with you, I know a lot of agencies who are small mom and pop, agencies, and the owner is the payroll person, and the owner is the administrator, or the owner is the DON, right? They have all these different hats, and they say they're also the marketer. Well, they're not marketing full time, right? And so right there alone, that's what's causing the problems. You have to go on your full offensive at this very moment. And that is why on how you take advantage of this. If you can't go full forward, don't just double it, triple it. You have to keep on going out there. And that's my biggest suggestion within this whole thing, is that you can take advantage of this. So let's talk about different marketing strategies that we're implementing, right? So we already told you guys about, cold calling, emailing, all these different things, right? Those are just the bare minimum. Now there's more advanced techniques on to go all in, right? So a good example is what we call Facebook pixels. Now this right here is typically something that we use for non-medical private duty services, home care services, right? And so we do what they call the Facebook pixels. So if you're not familiar, and if you don't have one right now, whether it's a home health medical or non-medical, you should have a Facebook page. You really should. People say, well, I don't want to have a Facebook page because it's not like I'm going to get any referrals. That is complete false, because you can. And this can actually happen for both home health and also for non-medical. So if you're taking advantage of the Facebook ads section, you can create ads within Facebook. Once you create an ad, this is of course paying for it, right? If you go through Facebook, you probably see sponsored ads, right? Whether it's in your feed or it's on the right side of your screen. But what happens is you can pay for ads and target the right people. Like, we actually have a full training about this in our 10xpatientreferrals.com online training center. And, using Facebook pixels is an amazing thing. So what happens really is, once you create an ad, you can create that pixel, for example. It's going to go into your web page. And what ends up happening is, a good way we do is when we send an email and say, hey, we have some information here for you. When they click the link, let's say we're sending them a certain video, right? A referral source. When they click a video, when they click that link, it goes into a website, right? A page. And within there is we put the pixel. And by us, and pixel pretty much just think of it as breadcrumbs, we'll say. Have you ever search for something on the internet, then all of a sudden you go to other websites, you start finding it there. There's an ad there for you. You're seeing it all the time. You go to YouTube, it's there. You go Google, it's there. You go to a certain web page like CNN.com, all of a sudden it's there. Or you go to Amazon, you take a look at one of their little products, and all of a sudden you see it somewhere else. That's pretty much, a lot of people say it's like the whole Big Brother thing. People are watching you. It's pretty much a pixel. It's a little cookie that gets installed there. So what ends up happening is if somebody then watches that, goes to that website, okay? And let's say we provide something of like a education. Hey, we want to be able to give you 5 steps on how to prevent your loved one to get infected by the COVID-19 virus. So we'll create an ad like that, for example, which we did actually. And we hit a certain amount of community that we want, the age, we already created that, how much they make, the area that we're trying to target. They see this ad and then they click the ad, okay? It takes them into a web page, a lead page, for example, and they view the ad, right? So what we can tell the pixel is that if somebody watches this video in entirety, we want to retarget that person. So what happens is when they go back into Facebook later on, they're gonna see an ad from us and saying, hey, we know that you watch our 5 steps to keep your loved one away from the hospital and getting infected by the COVID virus. And then we provide them with some advertising on our services on what we do, just in case they did not call us with the ads that we created. So that is one thing that we do is Facebook. We want to be able to do that. If we then, for example, send an email to a potential referral source saying, hey, this is something that you should look into. They look into it. Same thing again. Like, hey, we know that you looked our video about our services. We want to be able to talk to you a little bit more. So when they go back to Facebook, they're going to get another video of us following up with them. So it's the same exact thing. We're following up with these people as we go. So that's one technique. I can go spend a whole 2 hours talking about Facebook pixels, Facebook ads, but that is something that is for another date and for another training. But right now, that's something that we're taking advantage of right now, and Facebook gets us about 20% of our referrals in a monthly basis. Now, the next thing we also do is we make multiple websites. So let's say, for example, let's think about this. Okay, let's say, for example, I have an agency in the Chicago area, right? And so if I have an agency in the Chicago area, for example, we're providing home care services or home health services, doesn't matter. When we're handling, let's say, the county of Chicago, so that's Cook County, right? But within Cook County, there's several cities. There's Lincolnwood, there's Skokie, there's Chicago itself, there's Evanston. All these different cities within the county that we provide services on. What we're going to do is to make it easier for us to be searched when people are searching in Google. We're actually going to purchase several website names. We're going to say Homecare Lincolnwood, Illinois. Homecare Evanston, Illinois, Homecare Chicago, Illinois.com, right? Homecare Skokie, Illinois.com. We'll purchase all of these different domain names. We'll have our website made, and each one of these companies or these domains will have a website, right? It's the same website look of all of our other websites, right? But what happens is it makes it easier for eventually when people are searching for what? How do you search in Google? Home care in Lincolnwood, Illinois. But because our domain name, it has all those certain keywords, it has a higher potential rate that we're going to be able to rank up when people are doing a more defined search in Google. Same thing, let's say, for example, in the LA County, for example, right? If we're say Los Angeles County, then you have Carson, California, you have right Hollywood, Illinois, Hollywood, California. So we'll put home care hollywoodcalifornia.com, or home care Glendale, California.com. So by doing this, right, it's a small investment. A lot of you guys, like I said, remember, marketing is an investment and it's not an expense, okay? The whole purpose is to invest now to be able to what? To be able to get something in return and later on, right? This is a long-term game. This business, if you're in this business, the goal here is long-term. We're not trying to be a fly-by-night type of a business. We want to be able to create wealth, and we want to be able to create a business that's going to be able to sustain and last long, right? So that's why we're investing. Another thing we do is we do email marketing, right? And so a lot of you guys will say, okay, well, I do send emails. Here's the thing. you can automate your emails. Like when we go to a new referral source, right, when we visit them the very first time, we already know what we're going to be sending them for the next 10 weeks. We already have 15 emails that's going to be sent out to them. And so what happens is once we get their email contact, we put them in our email list, and the email system is automatically going to email that person on the days that we specify. So pretty much they're going to be receiving about 1.5 emails a week, right? So we're going to set up that 15 email stream that they're going to get. And a lot of people say, well, that's spamming, Michael. Well, here's the thing. How many times have people emailed you and you actually missed that email? So technically what we're going to see is those 15 emails, they might actually see 2 or 3 of those emails only because their feed just fills up with a lot of emails, right? They have so much information being sent to them. And so our goal is to be able to catch them with 1 or 2 of those emails and catch them between 1 call a week. That's where it all happens. And then we take advantage of video marketing. Like for example, in our home health agencies and our home care websites, we actually have videos that provides training for family members and patients. We have a video section for family members, a video section for patients. It gives them education. It speaks to them differently. It talks to the patient differently. It talks to the family differently. We also have a section that talks to doctors, another section that talks to social workers in nursing homes, and we have another section that talks to social workers in hospitals. Each one of those people have different problems, and we want to be able to hit them and show them directly to the link. Just like, for example, you're watching our videos right now. You're watching this video. We're providing education. Imagine if you can actually do this, but provide education, information about home care or home health services and how your company is the great choice because you guys provide education. Countless times where we provide some free videos, the social worker will show that to a family member, but the family member will choose another home health. But then all of a sudden, they don't like that home health, but they remember about the video that they got. They end up calling us. In our videos that we send, we're not saying, hey, give us patience. In the end, it says, hey, if you want to have more information, contact us. Go to this website, okay? And that is what is valuable, providing education, but in turn, eventually we're going to get referrals and increase our census. So what are you guys doing at this very moment? Also, if people cannot meet you, right? If they cannot meet you, they don't want you to come into their facility, right? We've done this several times, and here's the truth. We told, hey, listen, meet us outside. I know we can't come in, but do you have 3 minutes of your time? I'm going to bring some snacks. I'm going to bring a mask here. I'm going to give you your own mask. Meet me outside. Let's have a 3-minute quick chat. I just want to be able to put my, your name with a face, right? And these are things that you should be doing. Take advantage of different things. Take advantage of what you can do to make yourself stand out. That right there is such an important lesson that I want to be able to share with you guys. The main reason why marketers are going to be stuck is because they're not prepared, or the owners and the managers did not prepare on time, right? You have to be prepared. And if not, hey, the reason why you're watching this video is you're trying to find a solution to problems you're facing. And that's what we're doing right now, is to get you unstuck, to get you prepared, to give you enough material that's going to make you want to actually keep on working. What we need to do is we need to start training your team, right? Whether it's us or you. And most owners don't even know how to market anyways, where they have a sort kind of an idea on how to market. And that's why we get hired ourselves to provide training for the marketers, to provide training for the owners. And we even get hired full time where we actually manage the whole marketing team, right? So instead of a company, let's say, for example, hiring somebody, paying them $70,000 a year to manage the marketing team, we actually get hired for half that price, right? So instead of paying somebody $70,000, we can do that for you at half the price. But that doesn't mean that you use our services. You don't have to, right? But you need to provide some form of training. Whether it's through 10xpatientreferrals.com, whether it's you find another company that can provide services for you guys and training, whatever you need to do, you need to find ways to provide education, to provide information, because a person who has the right knowledge is going to succeed. But the biggest problem is this: people always say knowledge is power, but if you got the wrong knowledge, then guess what? You don't have the power, right? And also, you need to start working on your collateral materials. You need to have some good stuff. You should not have just a brochure, one trifold brochure. And just let you guys know, I go on a rampage about having a trifold brochures. Most agencies have a trifold brochure because they saw another agency has a trifold brochure. And the truth is, when was the last time that you opened up your own trifold brochure? So if you haven't even opened it up, why are you expecting other people to open it up for you? So you have to understand there's different collaterals that you guys can use. And in actually our online marketing bootcamp academy, which has like 9 hours of training, that has a full array of information, which is amazing for you guys, right? Now, so agencies will stop taking admissions. It's going to happen. And the reason why agencies are going to stop taking admissions is because they may not have enough staff or can't hire. So take advantage of this. Number one, when this recession is, when this whole step back, this COVID-19 restriction, when it gets opened up, you're going to have a lot of people that are looking for jobs. And you're going to be able to pick and choose the great marketers. You can pick and choose the great staff that you guys want to have. A lot of agencies are going to shut their doors because of this. So take advantage of it. Now, I'm not trying to laugh or, laugh at people who are suffering because, they're not going to be able to keep their doors open. But you have to understand, business is war. It really is. And I really hate to say that, right? And so it's a matter, just like, if you guys ever heard the book Art of War by Sun Tzu, business is war. And you have to understand one thing, is that in business, people will die, right? And I'm not talking about patients, I'm talking about businesses. And the reason why businesses fail is for the reason that they were ill prepared or they got outmaneuvered by the enemy. And so your job right now is to outmaneuver people. And so that's what we talk about taking advantage. You need to flank them, right? Where they are not prepared. And, sometimes it sucks knowing that this could happen, right? But it's just what happens in business, right? Think about this during the time before the housing market crashed in around 2007, 2008, right? Everybody out there opened up their own real estate companies. Everybody became, brokers out there, right? And, even the person who couldn't sell anything in real life, in a normal setting, was selling houses. But when the housing market crashed, it showed you the real great realtors, the real great salespeople, right? Because they really knew how to sell. And those are the ones that remain in the business until very now. And the other people just pretty much end up going to the what? To the unemployment line. Because they were just riding the wave. And so what's happening right now at this very moment, through a lot of different changes, whether it's, changes in Medicare, but at the very same time as with the current thing that happened, the COVID-19, we're going to see some agencies that are going to lose business. And at the very same time as you are in the position to be able to, number one, get those potential referral sources that are going to open up, but at the very same time is to flank the current businesses right now that are just slowing down, but are not going to really close down. So take advantage of what's happening. You're going to be able to find the right people out there, and you're going to be able to really win in this competition that's really what we call home health, right? Or home care. Another thing you need to be able to start preparing yourself is SEO. We talk about Facebook marketing. We talk about your creating multiple websites. SEO is what we call search engine optimization. That's why we actually did the multiple websites. And we are going to go in deep more on SEO, search engine optimization. Pretty much people who search in Google, right? If somebody's looking for services in Google, just think about yourself. When you Googled something, right? You don't really go to the third page of Google, right? If you're finding something, whoever pops up on the first page typically gets your business. And your job really is to make sure that you're doing everything on your website to go in the first page of Google, second page, or third page. Now, there's going to be people that's going to be calling you sometimes if you're the owner of a company and they say, hey, we can get you ranked within the first week or the first month in Google. I'm going to tell you guys that is a complete scam. Don't fall for that $1,000 deal thing, right? So you have to understand that this is something that needs to be worked on. An SEO that takes about a year and a half before you can get ranked up in the first, second, third pages, right? It takes time. It's really putting a lot of information in there, and we can spend a whole 2 hours talking about SEO, but we're not going to do that. So, if you need to look into it or have some questions, give us a call. We'll help you guys out. Or if you want to find out more, just Google it. Google SEO services, right? The next thing is Facebook marketing. We talk about Facebook pixels. Facebook marketing is such an important thing. The next thing is called geo mapping, right? So think about maps, right? So the thing though is what we can do nowadays is when we do geofencing, geomapping or geofencing is another term for it. What I can do is I can go on Google Maps, right, on marketing, and I can put a fence around, let's say, for example, Tampa Regional Hospital. I put a fence around Tampa Regional Hospital, then I can say, whoever goes into this fence, okay, I want you to hit them with these ads, okay, on their phone, on their websites, on their MacBook, on their laptop, wherever they are. And so we can hit them with advertising right there and then, okay? So that's another choice that can happen. Once again, we can go whole into it, but you can look it up in Google. Geofencing is an important thing. We're seeing a lot of good results for that. We know several companies that can provide these type of services for you guys if you guys need some recommendations. Unfortunately, we don't do geofencing, and the truth is because it's something that we just discovered about a year and a half ago, and we're starting to see great results with our home care companies. And it's also giving us great results for our home health as well, but not as great, not as high ROI or return on investment as the non-medical portion of things. And so geofencing it's an amazing thing that can happen. Just think about it, right? Anybody that walks in, I can literally say anybody that walks into an assisted living facility that I put a geofence around and I say, I want you to hit this person with our advertising. So I can become specific. The fact that they went into an assisted living facility, more likely could be a loved one, a family member, a relative, whatever it is, we can target them specifically because they walked into that particular assisted living facility, that hospital, that nursing home. All right, so that is such an amazing thing. The reason we heard about geofencing and we started looking into it because it was being used a lot in the restaurant business. It was being used a lot by the car industry. One thing that I do a lot in marketing is that when I first got into marketing in this whole industry, there was nobody really training or providing education like we're doing with you guys on how to market in the home health industry. And so I had to look outside the industry and bring it into our industry. So I took, pretty much training in real estate, in car sales, all those kind of things, and then figured out what applies here and then created my own systems. So anyways, we were starting to see geofencing being used for restaurant industry and the car industry. The way they were doing it is, they'll put let's say for example, I'm a Toyota dealer, right? And my biggest competition, let's say I know if somebody buys a Toyota, more likely they looked at a Nissan as well. And so what I'll do is I'll put a geofence around the Nissan dealership and say anybody who walks into the Nissan dealership, show them this advertising about, about the Toyota 4Runner or the Toyota Supra, okay? So that's a way to really target that. Or if I want to be a little bit more kind of, imaginative, I'm going to look for the other Toyota dealerships within and around me and target them as well, okay? And so those are little techniques that can be used in the restaurant industry. The way they do it is if somebody walks into Chile, I know they like Tex-Mex. So if I'm a Tex-Mex restaurant or a Mexican restaurant, I'm going to target people that walks into Chili's because they love that type of food, and maybe they might want to use or eat my food as well. So we looked at that study about 2 years ago and really got into the whole geofencing about a year and a half ago and are starting to see results. We're still trying to tweak it, but an investment of $1,000 a month gets us an average about 1 to 2 referrals for non-medical. So that's actually a good ROI because our goal is when we bring in a patient, we want to keep that patient for a year. So that $1,000 that we spend to get 1 or 2 patients, let's say $500 per patient, it's worth that, right? And a lot of people say, well, no, it's not. That's $500. But yeah, but if a patient I get and I service the patient for a whole year, I could potentially earn between $40,000, $50,000 for that one patient. So is it worth the $500? Of course it is, right? And once again, marketing is an investment, not an expense, okay? So that right there is something that you guys should also understand. The next thing we're going to do now is we're moving on to the part 3 of this whole video series, and that's how to prepare yourself on what to do once the COVID-19 restrictions are actually lifted. So let's go ahead and start talking about that. Okay, guys, we are now in the final stretch of the whole thing, right? We are in the part 3, the third portion of this training video series in regarding to how to be able to, number one, take advantage of the whole COVID-19 situation and how to be able to beat the competition. So in the part 3 section of things, we want to be able to talk about how to prepare on what to do once the COVID restrictions have been lifted. Once, the whole stay-at-home situation is taken out and where facilities start allowing us to be able to start coming into them and marketing ourselves to them and to be able to beat the competition, right? So in this portion, we want to be able to talk about that specifically, how to take advantage of it. In the first part, we talked about the 5 problems faced by most agencies because of the current closures that are happening. Part two, we talked about how to be able to have that unfair advantage over other agencies. And in this part, like I said, we're talking about what you're going to do and preparation before the opening or the stoppage of the restriction, and what is going to happen after that to be able to really take advantage of the situation and beat your competitions, right? So we want to be able to, first of all, understand this. While everyone is taking a step back, you need to get ready for the post situation, the post COVID. What happens when the situation gets lifted? When we can start marketing out there. Now, most companies are so worried that when restrictions are lifted, they may take several weeks or months even before they even get started. Because what happens is, there's 3 options that you can do. Number one, take a step back, right? And what happens is you fire some people, you close your offices, you take that step back. That's what some people are going to be doing. Then there's the other set of people, marketers or owners of agencies, that decides to do nothing during this whole thing. Just don't even create actions. And then the third thing you can do is to go forward all ahead, full blown, double, triple your workload, because that's how you're going to take advantage and win after all these things are lifted. So which one are you really? Are you a person who took a step back, right? So remember, imagine this. If you take a step back, it's still going to take a lot of energy to move forward just to be right there in the middle. Whereas if you're a person that do not even do anything, you don't change your ways with the restrictions, well, then you're stuck right there as well and you're not progressing in the future. Whereas if you are a person who actually took advantage of, number one, solving all the problems, making sure you know how to be able to attack people while the restriction was happening, and you started making sure you took advantage of making unfair advantage moves, and then now when the post-COVID era happens, you can push forward really, really hard and win in this particular situation. So, you know, first thing to do is to get back to basics. It really is the truth. And most agencies don't even go back or don't even look at the basics, at the core system of marketing your agency. And the basics is to create a marketing process. Most agencies do not have a blueprint set in place, a marketing process. Think of this as somewhat you are starting from scratch. And you have the opportunity, which is amazing right now, is to start from scratch with everything, a whole new life for your agency. Now, most agencies fail in marketing because they don't have a set process. Imagine this. We have a process on how we train our staff. Let's say you bring in a new nurse. You have a process, a policy and procedure in place on how to train them, to provide them training, to get them out in the field, to see what they're doing. If you have a caregiver, you have your orientation process, right? You have a policy procedure set in place, right? You guys have policy procedures for everything, right? If somebody calls in sick, you have a policy and procedure how to handle that. Yet for some reason in marketing, in sales for home health and home care and even hospice, most agencies don't even have a policy and procedure in place on what you guys need to do in order to be able to market your company, right? And you need to be able to have this blueprint and the plan. And this is where we actually help a lot of agencies. A lot of agencies, number one, where they join our online learning platform at 10xpatientreferrals.com, learn everything what they need to do in order to be able to market their company. Or a lot of companies have hired us to just really control and manage their whole marketing team. Either or, you can do which one as long as you're actually making plans of stepping forward. And that right there is the most important thing. So one thing we always tell people is if you really want to have a successful agency, marketing is 100% of your profits. Always understand that and always look at marketing as an investment instead of an expense. Because your job when you invest in something is to be able to get a positive return, your return on your investments, right? That's why it's called an ROI, return on an investment. We always tell people you should have weekly meetings for your marketing. And if you don't do this, you should at least do it every 2 weeks. Heck, most agencies don't even have these meetings in place. They just hire a marketer, send him off, and say, here, get us some referrals. And that right there is pretty much a recipe for failure. So, what we suggest is have your mastermind meetings. A lot of the stuff that we shared with you guys throughout this whole training came about because we actually had meetings. We put our team together, put our minds together, our ideas together at this very moment, and found out what are the problems that are being faced and how do we solve these particular problems, right? Because if it's easier to be able to have multiple people use their brains, put them together in a mastermind meeting, and that helps out. Now, if you don't have a large amount of groups within your organization to be able to have a mastermind meeting, the fact that you're watching this video is you actually joining a mastermind process and us being able to give you guys and bounce ideas on what you guys can actually do for your particular company. And just to let you guys know, if you watch this video, like we said in the beginning, we're giving so many different things to you guys, a lot of bonuses. You're going to be able to have the opportunity to be able to attend one of our live events, our Q&A events in a couple weeks that we're going to set up. And we're going to have several of these going on for the next month or so. You're going to be able to attend one of these live Q&A events where you can literally come in, join the meeting, and be able to talk to us. We're going to do it via Zoom or Ring Central, actually, where you can go ahead and input some questions, ask some questions and videos, and we're going to answer those if you're facing any problems and how we can solve things for you. So the first things first that you need to do is to have a process, and that's where we have our home health success blueprint put in place. One thing is, before you go out there and marketing, you should do what they call a comparative matrix. Compare your companies to other companies, looking at their websites, looking at their brochures, figuring out what insurances they're accepting, how they have their setups, what are their marketers doing right now at this very place. You need to be able to have a basic core understanding of what other people are doing. Why? You want to be able to look at what's creating success for other agencies and be able to replicate that and add more process to make yourself stand out. The next thing is you better be good at prospecting. Prospecting meaning finding the right places to be able to market your company, where to be able to specifically go in entirely. So a good example is this. Are you going to target all the nursing homes? That's sure a good plan, right? But here's the thing. What we love to do is we can actually break down the nursing homes in our area and figure out which one we want to really target first and who we want to be able to target richly. And meaning for that is that there is ways nowadays where you can actually go into a certain software and you can actually figure out which nursing home has the most amount of referrals for Medicare patients. And figuring that out, you can also find out, which agency they're working. That's right. I can literally find out which are the top 5 agencies that this nursing home ABC, for example, is referring to. I can even go into a doctor and figure out which doctor in the area has the most amount of Medicare patients that they're referring to home health services. And then figure out what are the top agencies that he's referring his patients to, which home health agencies. By me figuring this out, by looking at a bunch of data that you can actually acquire through, data.gov, by looking at that, you're going to be able to figure out and say, okay, if this doctor is referring to these 5 agencies, let me look at these 5 agencies on what they're doing that makes them stand out. At least be able to have a nice information put in place. The next thing is you need to start preparing your presentation. Do you guys know and have a proper presentation? And somebody tells you, tell me about your company. What do you guys say? What do you do? What do you present? Do you have your folders? Do you know how to be able to present correctly? Most agencies are going to say something like, we provide quality care, we have 24/7 on-call services, we provide skilled nursing, we provide physical therapy, occupational therapy, and so forth. And that's where medical home health. Whereas non-medical, if somebody asks you, tell me about your company, you're going to say, well, we provide, homemakers, caregivers, we provide, assistance with shopping, we provide, we go to doctor's appointments with you, we provide light housekeeping, and so forth. And those are what we call features, right? But the truth is, when you are presenting, you should be able to learn how to provide the benefits. What benefits can your company do? Do you provide homemaker services, or do you provide activities of daily living assistance to be able to make the patient feel better and to be able to guarantee that the patient stays home at the comfort of their home where they belong instead of going to the hospital? And then you can detail what you're doing specifically, not just light housekeeping, but really, why is light housekeeping important if you're providing non-medical, caregiving services? It's not just the features, but the benefits are such an important thing. But at the very same time in the presentation, do you have the proper scripts in place? Do you know the step-by-step process of a presentation? Or do you just go in there and pretty much go in there blind and just start talking? No. Anything that is going to be successful has to have a plan in place. Think about basketball players. Do they just go out there in the court and just start playing a professional team and think that they're going to win without practicing, without drilling, without having plans set in place? Now, if you want a full detail on a marketing process, at 10xpatientreferrals.com, we have that available for you. And we have a full complete training in there. And that's such an important thing for you guys to be able to look into. But one thing that we want to be able to do is towards the end of this video, because we're almost towards the end, we're going to share some more information to you. But like I said, you're going to be able to get information to be able to attend one of our live Q&A so we can actually really pinpoint everything. We have a whole training for just the whole marketing process, how to put that in place. And that's 7 hours worth of training that you should definitely take advantage of. The next thing is closing. Do you have closing scripts? Do you know how to close a deal? Just because you did a good presentation, but if you're not able to close and get that referral, it's worthless. How many times have you actually gone to a meeting or gone to a presentation where you marketed your company, or you heard one of your marketers say, I did a presentation at ABC Hospital. They come back, or you come back and you say something like, the presentation went well. And the reason why you're saying that is because the person you presented to said that to you. They told you, hey, you did a great presentation. The next time that we have a patient, we're going to give you a call. But then weeks goes by, months goes by, and even a year, and no referral comes to you guys. And the reason for that is you weren't able to close a deal. You weren't able to do also what we call follow-ups. And now how about this? Follow-ups is seriously about 90% guarantees you your referrals, guarantees you to be able to close that account for them to start using you as a preferred provider. So do you guys have a detailed follow-up process? So that's another thing we're going to share with you guys is our follow-up calendar. How do we set up our follow-up after we have that initial meeting, okay? And that is an important strategy for you guys to be able to have. Do you know what you need to do after you've made a presentation? Like, for example, we require our marketers, after they have that initial presentation, that within 3 hours, they have to automatically call that person that did a presentation to. Most people are scared to make that call. You'll probably call 2 weeks, a month later on, or just revisit again. But for us, we make it a requirement where they call them the very same day after that presentation. The very same day of the presentation, we also require that they send an email to those people to be able to say thank you to them. At the very same time, 48 hours after the initial visit, the administrator of the nurse of the home health agency or the non-medical home care company, they have to follow up with that referral source and thank them for allowing one of their marketers to show up. Now, this step-by-step follow-up process occurs for the next 3 months. And we have a step-by-step availability of telling you what you guys need to do to be able to make sure you follow up correctly. Because remember, it takes about 7 to 15 touches before you can actually get somebody to start using your services. It's actually the real truth. And 7 touches is one of the pinpoints that we're starting to see is going to be a great thing for you guys to do. If you can do 7 touches, a minimum of 7 touches, you're pretty much above there compared to the competition, and that's going to allow you. But a lot of people say, well, Michael, I don't even know what to give them or say the second time I see them. I don't even know what to say to them the first time I see them. Well, that's what we're here for, is to be able to provide you guys information so you guys know what to do when you're visiting them every single time. The next thing is, before it opens up, you need to start working on your marketing collaterals. Marketing collaterals meaning, what are you giving away? Do you guys just have your trifold brochures, or do you have presentation materials? Do you guys have a folder? Before you don't even need to go out there at this moment. So right now is we can start ordering these things, having them designed. A good way to have these designed, if you're not good at design, Photoshop or whatever, just go to canva.com. It's a great place that you can actually have ready-made designs, and it's a plug and play, add photos, add the words that you guys want. Or you can hire somebody to do it for you. Now, I always frown upon this company called Vistaprint because they have very basic generic style setups. And, when you use a lot of their, templates, it just looks regular and normal. Hire somebody. Sometimes if you're going to be able to stand out, you want somebody to design a nice flyer, a nice brochure, a nice rec card, a nice business card for you guys, because that allows you guys to stand out. Also make sure in your collateral, if you're using some photos, purchase some nicer photos, stock photos, make sure there's higher resolutions. It's so sad sometimes. I'll go to a home, to a nursing home or an assisted living facility, and they say, hey, put your brochures among the other brochures that are out there. When we look into the brochure section where every other home care companies, home health agencies leave their brochures, it's so funny how we typically see about 10% of those brochures, they all look the same. They even have the same photo in there. You know what I'm talking about. You've probably seen some other, brochures out there that has the same photo of the same lady, the same nurse in the front, okay? So make sure you adjust that. The next thing is, and pretty much the final main thing that you guys need to be doing, is that you need to start training your team. Start training your marketers to know what to do, to know what to say. A good example is this, is that you should have scripts ready made. And we're giving you guys some free scripts at this very moment. So for example, if somebody tells you you're already working with another agency, do you know how to respond? Most marketers will say, okay, well, here's my brochure, here's my pens, here's my mugs. Just give us a call when you have a patient. We want to provide you guys great service. Just try us this one time. You will benefit from this. This is what we hear a lot, and you should never ever do that. You should be able to have a script. So what we want to be able to do is provide you guys a whole list of the scripts available for you guys. If somebody ever tells me we are already working with another agency, I always answer this way. I say, ma'am, I knew that the moment I walked in the door. Other than the fact you're working with another agency, is it okay if I can have 30 seconds of your time? If I ask for that 30 seconds, guarantee they're going to give me that 30 seconds. Then that 30 seconds, by me asking for that, allows me to keep on going forward. My job is when I'm marketing out there, when I meet them face to face, is to be able to get permission to have another 30 seconds, another minute, another 5 minutes of their time, because I want to be able to show them that I value them as well. So we talked about additional bonuses that we said throughout this video that we want to be able to share with you, that I personally want to give you, and at the same time as give your agency. These are things that I believe that you guys should actually have. What if I can get you access to our Home Health Marketing Blueprint so that you can leverage the detailed step-by-step process and give you every information you need to be able to market your agency, whether it's a home health, a home care, or a hospice agency. Imagine if you have access to all of our amazing training and secrets so that you can leverage this to be your competition. You should join hundreds of other marketers and other agencies out there that's getting this training at this very moment. Now, because of the social distancing order and fears that has happened, that has come about, we had to postpone actually our live bootcamp events that was scheduled, where we were supposed to spend a full day to give attendees everything they need to launch their agencies to the next level. We were going to have it in a variety of different cities, from Los Angeles, San Bernardino, California, Philadelphia, Dallas, Houston, Chicago, Tampa, Miami, Orlando. We were going to be all over the place, where actually all of these events were already sold out. That's right, sold out. Now, since the restrictions, what we ended up doing is this. Since we still wanted to provide this information, we actually created and recorded all the information that was supposed to be given at these live events and created our online marketing bootcamp academy, right? And then we actually sent over to all 935 paid attendees access to this online bootcamp. It's over 7.5 hours of amazing information that gives them the success, the head start to be able to beat the competition. What we want to do right now is that we actually want to invite you to attend the same 7.5 hour amazing information event, where you will learn the Home Health Marketing Blueprint on how to increase your referrals and beat your competition. You will seriously have access to this online marketing bootcamp for a discount rate of $179. Okay, so what we ended up doing is we gave them access to the online marketing bootcamp, and once we reschedule the future events, they're still going to be able to attend those, which we're going to be giving additional amazing offers to them as well. But right now, because we're doing the whole social distancing thing here, we're at home, you want to start learning and preparing for when the restrictions opens up. The discounted price is really for a limited time only, and we will be putting it back to the original price within the next few weeks. Actually, we're thinking about it within the next 14 days to be exact. Our first launch of the online bootcamp got an additional 723 attendees, in addition to the original 935 attendees who actually paid for our live events. So that's over 1,650 attendees. That's pretty much almost 1,650 of your competitors have attended this event, because they came from all over the United States. Now, of course, we also want to add more value for you and other items to the boot camp to make the most of the current situation. We just want to always add value, just like what we share with you guys when you guys are marketing to these potential referral sources, is you always want to add value and show more for them, that you can provide more value to them so that they want to use your company. Now, you have heard me talk about our online training platform called 10xpatientreferrals.com, which has more than 150 hours of audio and video training content. We talked how important it is to have a training platform for your marketers as well as a reference for you to know the strategies in marketing. So if you're a marketer, this is a great platform for you to be able to have, because it pretty much answers all your questions from objections to closing, as well as how do I cold call? How do I approach somebody with a nursing home and a hospital? Now, if you're an owner of a company or a manager, it allows you to be able to know what to provide training to your team. Because a lot of the times we don't know what to train them with. And this is such an amazing platform that you can use to train them, right? Now, just to let you guys know, the program, 10xpatientreferrals.com, you have access to it in your laptop, in your phone, in your tablet, in your home computer, whether it's a Mac or a PC or even a Chromebook. By now, when you register for our online marketing bootcamp, you will get a 3-month access to our gold plan package for our 10xpatientreferrals.com. So you're going to get access to our online bootcamp, that's 7.5-hour training, plus a whole month access to our gold package with 10xpatientreferrals.com. So that's for $289, okay? Now, so for that $179, you're gonna have access, right? And that's an amazing thing right there. Let me just share with you, what else you're gonna be getting. What else will you be getting in this online platform? You're gonna be learning how to be able to market to physicians, hospital marketing, cold calling techniques, marketing strategies, the marketing basics, how to be able to get those appointments, closing scripts and techniques, your follow-up strategies, how to market to nursing homes, how to handle objections, finding great marketers, your prospecting strategy, right? How do you know which are the right nursing homes to actually go to? Getting past the gatekeepers. This is an important thing because a lot of times we can't get a hold of the most important person in the facility because these gatekeepers are preventing us. So these are just a few different things that you're going to be getting if you guys actually attend our online bootcamp and is part of our 10xpatientreferrals.com. Now, hey, listen, if you guys want to just not pay for the bootcamp and you just want to join us at 10xpatientreferrals.com, you can go ahead and do that as well. But the truth is, this is probably one of the best routes and deals that you guys can actually get. Now, I'm sure that as you all are learning all the different techniques, you may be having more questions to ask about marketing. Because there's one thing where you watch a video, you read some books, but then it's always nice to be able to have the live Q&A settings where you can actually talk to myself or anybody of my team members that can help you with your marketing questions. So we also want to answer your live questions, and you will be actually invited to our Mastermind online Q&A sessions. We're going to have several of these Mastermind online Q&As within the next couple months, so you'll be able to attend every single one of those and have the opportunity to be able to do what? To be able to ask us questions. Now, if somebody just wants to join our Mastermind Q&As, they can just go ahead and pay for that. It's a one-time fee of $199 per one of those events, and they can ask all the questions that they actually want. But what we're doing here is you're getting this whole package where you're getting the live Q&A sessions. You're going to be able to get access for 1 month at our 10xpatientreferrals.com, and you're going to get 7.5 hours of our training, our online marketing bootcamp training, and you're going to get all that together. Okay, so this is such an important thing for you to be able to look into, right? In addition, we also teamed up with medicationreminderprogram.com, right? So you guys probably heard me talk about them in other videos or even the current videos right now. What Medication Reminder Program does is that it reminds patients to take their medications, right? They're going to get a call every day, 7 days a week, 365 days a year, right? They're going to get a call at 9 in the morning and at 5 p.m. reminding them to take their medications. This is such an important tool for you to market your company because it makes you stand out. So what happens is if you sign up for the online marketing bootcamp, you're also going to get, a silver package, which is $150 value, which is we're going to call up to 10 patients of yours twice a day for the next month. At the very same time, just think about how you can use this to market your company. You can stand out by telling people, hey, we provide a daily medication reminder program to reduce the hospitalizations of our patients. That right there makes you stand out right away. Next, we are also giving you our closing scripts, right? And objection handling scripts. Other than watching the videos, you're actually going to be able to get a PDF copy of all our closing scripts and objection handling scripts. Imagine if you can actually handle the question. If somebody says, we are already working with another agency. Typically, most companies will just buckle down and say, well, here's my brochure, here's my business card. Please give us a call, try us out. You won't regret it. But there's ways actually to handle those, to be able to know how to respond when you get objections, to be able to know how to close the deals. Remember, there's one thing that you can present your company, but if you cannot close, you are not successful. Now, since your first month of the Gold Plan for 10xpatientreferrals.com is free because you're joining us, right? If you decide to continue the membership, you will only pay $179 a month instead of the $289 monthly. That's right. Our Gold Plan is $289 a month, and you're just going to be paying $179 a month if you decide that you want to continue on with the membership. If you don't want to, just go ahead and unregister, and it's perfectly fine. There is no pressure at all. If you prefer to cancel within a month, you get to still keep all the free content that we're giving you guys. You get to keep the closing scripts. You get to go ahead and keep the objection handling scripts. Go ahead and enjoy the training that we gave you guys. All that is included, right? So no pressure at all. But we just want to be able to keep on adding value to you. To add even more to all this, if you remain a member of a minimum of 2 months, you will get a free ticket to our live bootcamp event, which is a $699 value. That's right, $699 value. You can attend our live bootcamp events that's going to be happening right in the near future once we're able to have the restrictions lifted and schedule it correctly. Finally, since marketing is so important and business cards are a vital thing for any marketer, let me ask you right now, do you have your business cards on you? The truth is this, the best way to measure a marketer is if they go through 1,000 business cards within a 2-month period. That means they are actually doing their job. 2 to 3 months, you should be out of those 1,000 business cards that was printed for you, okay? So you're gonna get from us 1,000 pieces of full color glossy cards for free, just pay for shipping and handling. That's right. You'll send us the information about your business card, right? You'll give us the file and we'll have that printed for you. That's a $120 value. You're gonna get it. It's full glossy, both sides, full colored. That right there is such an amazing thing to be able to have. You need business cards. So once again, you're getting a $120 thing for free again. As long as you stay a member, you will get also the medication reminder program and call answering service as well. So think about this, right? The medication reminder program, yes, it's going to take care of your patients, but it makes you stand out and may get you more referrals. So just that alone, you're going to get our medication reminder program. That's an amazing thing. And you're also going to get call answering services as well. And that's also for free. So as long as you remain a member, that $179 a month after the 1 month for free, continue on, you're going to get access to that. And that right there pays everything enough already. But what's important is the referrals you can get, remember, right? What you're going to get from the training that you're going to get, right? Let me share again with you what you're getting all together, right? By just paying the $179 for our online marketing bootcamp academy. Number one, you're going to get access to our online marketing bootcamp academy. That's $179. You get 1 month of our 10xpatientreferrals.com access. That's our full training. That's typically $289 value. You're getting that for free. You're going to be able to attend up to 3 of our mastermind Q&A video conferences, which just cost $199 each. And you're going to be able to get that for free. The medication reminder program and the call answering service, that right there is, $149 for one. The answering service is $99. That's for free as well. You get the closing scripts, and you also get the objection handling scripts right there alone. People have purchased that before from us for $150 each. Once again, you're going to get that for free. Also, our live marketing bootcamp event that's going to be rescheduled soon. So, we were sold out, but because we are doing this and a lot of people are interested and saying that I missed it, I should have known, I should have registered, I want to register. So we actually opened up our seatings and doubled it now. So you're going to be able to actually attend whichever you want, as long as whichever city is available that you want to be able to go into. If you're in the LA area, don't worry, we're going to be there. We'll be Chicago, we'll be Miami, Orlando, Tampa, Philadelphia. We're going to be there. Okay, so you choose where you want to be able to attend. So you're also going to get free access to that, a free ticket, if you guys stay a minimum of 2 months. All right, another thing you're gonna get is the business cards, 1,000-piece full glossy business card, $120 value. And then what we're gonna throw in for you guys is that we are having our 1-hour virtual coaching sessions, a $500 value. You're gonna get that for free. That 1 month, you're gonna get a chance to be able to have one-on-one with me for 1 hour and ask me anything, one-on-one. You can have your whole team there, or just you and me. And that's a $500 value, and you're gonna get that for free. Now, so that's over $3,000 of products just by joining our online marketing bootcamp for $179 to be able to make that decision at this very moment. Now, I know you're gonna say that $179 and that's a lot of money. Hey, listen, completely agree. It could be a lot of money for you, for me, for anybody. But what if you can get just one referral? Just one referral a month from the techniques, all these amazing techniques you're gonna learn. How much is that one referral gonna cost you? How much is that worth for you? Now, I know it's different for a home care to a home health, but I know for a home health, imagine that, one patient a month that you get, that's $5,000 in average. If you're a home care company, right, and you service somebody for 40 hours a week, and then you're charging $25, how much is that going to be worth? So is it up to you to make a decision? Is $179 an expense, or is it actually an investment? Most people right now will have to make a decision. That is to retreat or to create massive action. I would say that taking action right now by buying into this, by being able to make that decision, shows you what you are about, shows that you actually want to succeed. So there's two options: either learn from what is working now and bring success, or learn through trial and error. Either or, it will cost you. And what we are giving you is not to waste your time. Imagine the time that you're going to lose by trying to figure out things by yourself. Whereas you can take a lot of information that's already worked and you can springboard with yourself right away. So you're not wasting money and you're not wasting yourself time. Now, to add really more value, I'm just really just going to add something else to you guys, right? I'm just going to add this one thing. I didn't even think that I was going to add it, but I just wanted to right now. So it's not even in the list. What I'm going to do is this. If you sign up right now, if you sign up at this very moment, what we're going to do is, even if you only stay with us for 1 month on our membership platform, even if you stay just for 1 month, we're actually going to still include you in our separate email list, where you're going to get an email from us and access to our monthly presentation topics. A lot of people just keep on wondering, what should I be presenting every time I visit? And every month, we'll give you topics on what you should be talking about, what you should be educating your current referral sources to be able to create success. So to finish just things off, right? I just wanted to thank you so much for your time, and I hope I was able to provide you guys with so much value, and hope to see you in our live online Q&A sessions, and even in our live bootcamp events that's happening all over the United States. So if you have any questions, my thing is this: give us a call, send us an email. Our number here is 630-340-8990. We can accept text messages that go straight to one of our representatives, and I'll get notified, or one of the other team members will get notified. You can send us a quick voicemail. You can send us an email. We definitely want to be able to talk to you guys. Now, here's the thing. Just to let you guys know, I'm really going to be honest with you guys. Once everything gets lifted, right, things are going to change. So it's up to you guys to be able to create action at this very moment. All right, so this whole thing that we're giving you guys, this preview, these additional bonuses, it's going to go out the door, right? This is just strictly to help a lot of agencies, because we know that agencies are suffering. And it's not over yet. So there's going to be some agencies that are not suffering yet, but once the next week starts happening, the next month starts going, then we're going to start seeing more problems. And we don't want this to be you. We want you to actually be the one to take advantage, and that's why we're giving this to you guys. So all I can say right now, there's some buttons down below. Please make sure you click, you join us. It's $179. Just think about that. It's $179. It's not a lot of money, but it's going to be able to springboard you guys to the next level. Remember, you're already in this business. This is the business you guys decided to get into. This is the job that you actually decided to get into. Sometimes, if you're a marketer, the owner of the company, the administrators, they may not provide you with all the information, but you cannot blame them sometimes. But you have to look into yourself and say, what can I do to become successful? The last thing you want to do as an agency, as a marketer, is do the same exact thing that other people are doing that is not really becoming successful for them. So create the action right now, make the decision right now, click the button, join us at this very moment. It's going to be such amazing information. We're here for you. Jacob's here for you. Jesse's here for you. We're going to be able to here to support you to be able to create success for your company. First of all, this is Michael with Home Health Success Academy and 10xpatientreferrals.com. Thank you so much for joining us in this wonderful training that we just provide you. Have a